and welcome to the World Patient Safety Day webinar. And today's webinar is in partnership with the Bridge Clinic, which is a partnership made in Quality Heaven and is between two organizations that I've had the pleasure of working with. So my name is Dr. Ifunanya Ilodibe, and I'm the VP of Medical Services, Quality and Patient Safety at EHA Clinics, and I'll be the moderator for today's event. I'm particularly honored to have the pleasure of introducing the speakers of today's webinar, all of whom have made my journey as a physician manager and a quality enthusiast what it is today. World Patient Safety Day is celebrated on September the 17th every year, and it highlights the importance of preventing and reducing the risks, errors, and avoidable harms suffered by healthcare patients. And one of the major ways of ensuring patient safety is by setting up quality management systems, and that's why we're here today. So in commemoration, the World Health Organization asked us to wear orange for patient safety, and that's why we're wearing orange today. So the theme for today's webinar, as you can see, is the impact of quality management systems on patient safety. And our sub-theme is based on the World Patient Safety Day 2022 theme, which is medication without harm, which is prioritizing safe medical practice. So I'm going to go straight in and talk about our agenda for today. Just a brief introduction and overview of what's going to go on and some ground rules. So we'll have our first presenter, who is Dr. Ajayi, and then we'll have Adam talking about leveraging technology, then Dr. Anthonia talking about setting up a medication management system, and then Dr. Toyin will take us through understanding quality management. After each session, there will be a brief, every session is 30 minutes, so presenters take note. We'll have a brief question and answer session after each session. We'll allow 2 questions over a voice. So if you're interested in asking a question, just raise your hands and we'll just take on the queue. If we have more time, we can take 1 or more questions. But if there's no time, please put any questions you have in the chat box. And then we have a brief question and answer session at the end, and we'll take all your questions then. Also to note that all the webinar recordings will be made available on the EHA Clinics YouTube channel called EHA Clinics Official. If there are no questions, we're just going to go right ahead and start with our first speaker. And I'm going to have the pleasure of introducing him. So our first speaker is Dr. Richardson Ajayi, and he's an accomplished gynecologist, healthcare entrepreneur and experienced director and board chairman. He spent the last 22 years spearheading a healthcare revolution in Nigeria. He's educated in the UK. He studied at King's College London, where he received his MBBS in 1988, graduating with distinction. And in addition to his medical training, he is a gynecologist and a fellow of the Royal College of Obstetricians and Gynecologists of the UK. He has an alumni status at the Lagos Business School, the London Business School, the Harvard Business School, and is a chartered director at the Institute of Directors in the UK. Having dramatically expanded access to fertility services in Nigeria with Bridge Clinic, which is ISO 9001 certified by Quality Austria since 2004, he also promoted and scaled PathCare, a diagnostic lab company that has been ISO accredited 15189 since 2006 by the South African National Accreditation Systems. And after scaling to 26 locations across the country, he exited, and the company, which is now Synlab Nigeria. Dr. Ajayi was appointed as the chairperson of the Lagos State University Teaching Hospital. He is the chairman of Salvio Medical Management, a medical services organization focused on taking the distractions of managing a business from healthcare professionals so they can focus on providing care. He also currently serves as the chairman of the board of trustees of the Psychology Riding Club, with a focus on establishing cycling as a lifestyle in Nigeria. He is also chairman of MediCenter, primary healthcare brand, and the chairman of private sector coalition Stop TB Nigeria. He served as president of the Nigerian Rugby Federation, which is a focus on getting rugby into Nigerian schools. He's currently consolidating his holdings while focusing on governance and scaling health systems, as well as private sector integration of health systems. Ladies and gentlemen, it's my pleasure to welcome Dr. Richardson Ajayi. So thank you, Dr. Ajayi. I'm going to stop sharing my screen so that you can share yours now.
Thank you very much for that kind introduction, Ifunanya. So thank you very much for the invitation to this, and congratulations to EHA on what you've achieved. I watched the video and it's very impressive. Thank you very much. So you've asked me to speak on effective leadership for engaged quality management systems. I've decided to take my talk more from, rather than looking at safety on its own, but looking at it within the context, quality management within the context of a business. Sorry about this, I think I've lost. So, as been described, I have quite some experience with quality management here in Nigeria. My first foray was with Bridge Clinic. I remember listening to a presentation in Austria about 2001 on quality management, and it became very clear to me that you really could not run a healthcare organization in Nigeria without having a quality management system. Because it ensured you broke everything down into a way that it's easy for staff to understand what they need to do. So Bridge Clinic was ISO certified in 2004. And I'm proud to say, I think we were one of the first healthcare organizations to do this, and certainly one of the first IVF clinics, even in the English-speaking world, including in the UK. Pathcare was accredited by SANA since 2006. And my other in the MediCenter, which we're working on building a primary care brand since 2017. And we're currently working in Lassus to get JC accredited. So I have quite a bit of experience with management systems. So today I'm going to talk to you about why quality, differentiate between quality control and quality assurance and quality management system, expand on quality management systems, talk about external validation of your QMS, then talk a bit about the principles, really from the point of view of driving the business, and then I'll talk about the role of leadership. So I think without quality, patients don't come back. Unhappy patients don't come back for your services. And it doesn't really matter what you're selling. If you're a barber and you can't cut hair properly, you will lose your clients. So it defines fitness for purpose. And it's really defined by the customer, and defined by you satisfying the customer. And it's important to state here that quality is not a premium, because sometimes people say, oh, at least it's like some patients fly in business class and others fly in economy. I say, no, quality means the plane can stay in the air. So it's not about comfort. It's not a nice to have. It is a non-negotiable that ensures that you're able to deliver to the customer. And I really think it's a non-negotiable in presenting a compelling competitive advantage in any business. You really need to focus on ensuring you achieve what patients want from you. And I really believe that in healthcare, where we deal with people's lives, and something so important as healthcare, quality focus is a non-negotiable. I think it's irresponsible of anybody not to focus on making sure they get things right to satisfy the patients. Now, what's the difference between quality control and quality assurance? Quality control is what most people understand, and it's reactive. The goal is to detect errors or mistakes in a product and focuses on shipping quality products by removing defective products, and it takes place after development. What do I mean by that? I mean, if you're making nails and your objective is to ship a box of 100 good quality nails, so quality control means that after the nails have been made, you sift through them and you choose 100 best, and you throw away the defective ones. So from a customer point of view, you've controlled the quality. They get a box of 100 perfect nails, but you've also created some imperfect nails. Now, quality assurance makes sure there is no imperfect nails. And I think you will all agree with me that we don't have any margin for error in healthcare. So healthcare is all about quality assurance. Okay? It's proactive. The goal is to prevent quality failures before they occur. And we focus on making sure processes deliver the quality product. And the processes examples are even making sure you employ the right people, employ the people with the right attitude, making sure you onboard them properly, making sure you have clear processes for them to work with, making sure you test their competence on the product, making sure you audit the process, and ensure that at the end of the day, you deliver 100 perfect nails. It takes place throughout the development process. And this is key in healthcare because there's nothing like making mistakes and then controlling it. So quality assurance is really what we're talking about when we talk about quality in healthcare. And the objective of quality assurance in healthcare is patient safety, number one. Number two is to ensure that whatever therapy you're employing is effective. It's also about being responsive to the patient in the way the service is delivered, and also to make sure that you're caring during the process. So it's quite clear what we need to achieve. Patients must feel safe. They must feel we're responding to them. They must get well, and they must feel cared for throughout the process of engagement with our brand. So when you talk about quality management system, it's really everything you do to drive quality assurance and deliver those four things to the patients. And there are 7 principles of quality management. I'll talk a bit more about this later, but I'll mention them now. Customer focus, engagement of people. You must have a process approach, and that's what I was talking about when you break everything down and you have very clear SOPs. Engagement of people, let me talk about that again as well. I mean, really, the staff are the ones that deliver care. So whoever is designing the medical system, the patient's touch points are usually at the reception, at security, as they walk into your clinic, the nurses. So everybody has to have a quality mindset. And that comes from making sure that you recruit the right people and you put the right systems in engaging them so they understand what it is that is required of them. Then once you've done that, of course, you break your processes down into ways that everybody can understand and have your SOPs so that people can read them, understand them, and run their operations according to the SOP. So you have to also test conformance to the SOPs with audits. And then you also need to test competency to make sure that they know what it is they're doing in the way that they deliver their work. Then your decisions must all be evidence-based. There's really no time for the art of medicine. It's all about the science of medicine, evidence-based management. All the suppliers and everybody that interferes, because your supplies is also part of your quality management system. So you can't have a quality focus and then you receive supplies that don't meet standards. So you need to really make sure that everybody that works with you, from the cleaners, understand what it is that you're trying to do. And then you need to constantly look at improving the operations by constantly checking, and when things go wrong, make sure we understand why they went wrong, root cause analysis, correct what went wrong, and make sure that you prevent it by sometimes developing new policies to ensure that there are new SOPs written if the issue is with the SOP and everybody understands where we're going with this. And of course, everything rests on leadership. Without the right leadership, this will not work. And I'll talk a bit more about this as I go along. Now, ladies and gentlemen, quality management is a philosophy in how a healthcare organization is run. It is not a department, it is not a certificate, it is a strategy that runs through all aspects of the business. It's a governance system. It lives with the leadership. And we can't really afford to just think it's about a certificate. I think the certificate, in my own experience, I remember when we went for the ISO in the early days, the objective was to get a certificate. And we believe that once you had the certificate, you could put it on the wall and you could say, well, we are ISO certified. But let me tell you, it means nothing, because it is the patients that decide whether you're ISO certified in the level of service that they receive from you. So you as a leader, you need to cascade the philosophy into every part of the business, and you need to effect culture change, because without that culture change, nothing changes, because people come from their different experiences, the different education that they've had, different mindsets. But how do you get them to have a quality mindset and put the patient first? That's really the job of leadership. So the journey, I believe, starts with the certificate, and then you now need to work through, how to drive that philosophy into the organization. So the culture change is the quality management system, and it's not about the certificate. It's all about the customers. So yes, we may have certification, and that's nice. It's a good start. But how do we get the whole organization singing quality, so that as patients walk into the clinic, into the hospital, they know there's something different about this place, and not only just in the infrastructure, but the way the staff relate to them. And once you've decided to go on quality management, and you have all the systems in place, then you need to think about what accreditation system you want to go with. I mean, there are different types. ISO is a generic standard, and I put this here, comparing all the different standards. So the ISO standard is generic. It focuses on your management systems. The other four, Accreditation Canada, JCI, COSASA, and SafeCare, are more focused on healthcare organizations. So, but ISO looks at management as a generic concept. And so, for healthcare organizations, you may want to add one of these other ones onto it. But I won't go into all of the differences. I can share the slides at the end of the presentation if anybody wants them. And the second thing to talk about is the difference between certification or accreditation. The certification process basically focuses on process conformance. It says you have all the processes in place to deliver quality services. It doesn't really talk about your product. Now, most health systems are accreditation systems with a focus on ensuring you have the right processes. Accreditation, on the other hand, talks about product conformance. So I talked about Bridge Clinic and Pathcare earlier. Bridge Clinic had certification because it's difficult to get accreditation in IVF, because that means your pregnancy rates are better than anybody else. But in our diagnostic business with Pathcare, we had accreditation, which is ISO 15189. And because you can't have results that are not accurate. So ISO 15189 says your results are perfect, because it's about running your controls, calibrating your machines, and ensuring that a sugar of 5.7 out of your laboratory will be 5.7 in any quality assured laboratory in the world. And that is a competitive advantage. And I think it's also essential that in a diagnostic business, it's not just a question of taking blood and getting a result. I think you must have a quality management system if you're going to run a laboratory business. So the principles of quality management, I've talked about these, and the standards have evolved, and really one of the key elements that have been added is the concept of stakeholder management. So it's not just looking at the patient, you need to look at all stakeholders and ensure that you have criteria to ensure that you satisfy all stakeholders in what it is you're doing. And a good example of this is perhaps what's happening in the Niger Delta with the oil companies. Because if oil companies did stakeholder management and looked after the people in the community, there will be less issues with the business. So quality is really an all-encompassing philosophy about making sure you do everything that drives sustainability of your operations. And then risk-based thinking, because things will go wrong. And the idea is that you need to make sure that you predict them and put plans in place to solve these things. And then building all your processes around the customer. So you're not looking at finance as an isolation. You're looking at finance in a way that it relates to your patient, and you design your processes in your finance department from that point of view. Thinking your patients need to have a system of reconciliation. They must have an easy way of paying you. They must have an easy way of getting their invoices. And just thinking about the patient all around. And you can imagine if you employed an accountant or someone with a generic perspective, they may not understand the nuances that is required in healthcare management. So having those processes built with the patient in mind helps, drive patient satisfaction. So patient satisfaction is not just driven by the doctors and the nurses. Your back office staff also need to be part of the system in trying to understand what it is that they're expected to do. So, ladies and gentlemen, your QMS is really your strategic plan, right? It's not something that is added to it. It's an all-encompassing concept around your business. And you need to make your strategy clear, and you need to communicate it. And the leader is the strategist, because you need to have a clear purpose of why you set up the business. And I like the video that we watched earlier, and the clarity of purpose on why EHA needed to be set up. And a video like this communicates it, but it's also important to document it in a way that everybody that works in the organization understands why we exist and where do we want to go with this business, what values are critical to us, and because the values define the playing field on how we operate. Some people may operate and say, well, we're going to give some kind of rebates to people that refer patients to us. People say, no, it's unethical. We're not going to do that. We're going to compete on just delivering the quality that patients demand of us. So these are all values that you may choose into, but it's important to communicate it and make sure there are systems in place to enforce it. The vision must be made alive with a clear strategy to articulate the vision, a clear implementation framework with clear milestones, and the milestones must have clear accountabilities in terms of who is expected to do what. And then you need to be able to cascade the accountabilities into a performance management system that ensures that everybody's on the same page and everybody's rowing in the same direction to move the boat forward. I put this here just to remind us that, strategy needs to be communicated. And once you're clear on what you're doing and everybody knows where the organization is going, then and only then does your quality management system make sense. Because if you're doing quality management system in an isolation without a clear direction that we're going with it, then it's just an activity. So that if you focus on your vision and on your strategy, then quality management starts to make sense. For example, how do you engage, how to engage your people to focus on the strategy, getting them to focus on the patients, because it's through patients we make money. If we don't satisfy our patients, then they're not going to come back. So I wanted to make that point that the quality management system needs to have an objective, and that objective is to drive the strategy. So I just broke this down just to say a few things about the principles of quality management. So like I said, the first is to ensure that we satisfy our customers. So they must feel safe, our treatment must be effective, they must feel we're responsive to them and we're caring. And if you get that right, they will tell their friends, they will come back. And that's really what drives the economic engine of a healthcare business. We just must do what the patients want. And the other side is, like I said, customer satisfaction is delivered at the front line. So you have to engage all your staff. They have to be part and parcel of what's going on. Town hall meetings to hear from them and involve them in all the thinking. So they feel that they're part of it. It's not that they're working for someone, but they're working for themselves within an organization with a focus on exactly where they're going with their own vision and for their own lives. And then the processes, if you don't break down your processes, it's hard to codify them. It's hard to train the staff on them. It's hard to certify them competent in able to deliver this and drive improvements. And then, you have to design audits to ensure that people are conforming to the SOPs as they have been defined. And if there are any gaps, then you need to look at what training requirements are, or whether it's the kind of people that have been employed, and they may need more deeper engagement to ensure they understand what is required of them. And I've said evidence-based medicine is good medicine. So it's important to know that whatever treatment is not just something you've heard about, it works. Because don't forget, effectiveness of therapy is part of quality management and it's patient expectation. So it's important we deliver that. Relationship management, suppliers are part of your quality management system. I've said that earlier on. And then continuous improvement is a very key element because things will go wrong. Things will go wrong. Is it just because things went wrong because people did not follow the SOP? You will have incidences and you have serious adverse events, which are where incidences affects patients' treatment or outcome. So it's important that, in any organization with a quality management system, you have to have a reporting system where these things are reported. You want to hear about every incident. You want to hear about every SOP, and you want to discuss them. You want to learn from them. So the whole concept of CAPA, which is what is the corrective action? So how do we correct what went wrong? And that's easy enough to do. But more importantly, how do we prevent this from ever occurring again? And that's where you need to look at the SOPs and you need to look at the training. And sometimes you have to have new policies written to ensure you prevent this. And then I like the whole concept of logging all your incidents and SAE and using them as a training tool. Because I think, the organization, as it moves along, needs to develop intellectual property. And that intellectual property comes with learning. So you can make a mistake today, and we shouldn't make the same mistake tomorrow. Tomorrow, other things will go wrong. But as the organization moves on, and you're creating your organizational learning framework, so the CAPA log is part of your knowledge management system. And leadership is really what holds all this up. The fish rots from the head. And basically anything that goes wrong in any organization, you cannot divorce the leadership from it. Because if the leadership is not on the ball and part of this, then really and truly, nothing will change. Because the leadership, everybody looks at the leader. And if the leadership, thinks quality management is a certificate, that is all it's going to be. If they think quality management is a strategy and they design the organization around quality management, then that's what you're going to get because people only respond to what is measured. So if you don't measure the journey of your quality management or accreditation, then it's just a game. I've talked about stakeholder management and I've talked about risk-based thinking. Making sure that you sit there and as a strategy, what could go wrong? What is the impact of anything that can go wrong? And what's the certainty of it going wrong? And how are we going to mitigate against it rather than mitigate against it to make sure that we solve this problem before it occurs. Yeah, and this is the whole concept of processes. I mean, this is the Bridge Clinic, looking at management and governance processes at the top. Really strategic aspects of the business, and then looking at the core processes, and then looking at the support processes, and having clear SOPs with clear KPIs for each process. And once you've broken it down, then it's easy to teach people. And then and once you create it, I say you need to create a virtual system that is self-referential and runs itself. And each process feeds to the next by making sure you have your clear processes and clear deliverables in terms of inputs and outputs and keeping an eye on those. And if you're able to do that well, then this system just runs itself without you really being a cog in the wheel. So ladies and gentlemen, in summary, I wanted to talk about quality, differentiate between quality control and quality assurance, as well as talk about quality management systems. Expand on quality management systems, talk about external validation, in terms of whether it's certification or accreditation, talks about principles of quality management, the role of leadership, quality and practice in terms of driving the system. I hope I have done that, and I would like to conclude by saying leadership needs to learn to work on the business, not in the business. Quality management allows you to have levers of control and things to pull to keep an eye on things. A quality focus is a non-negotiable in healthcare delivery. You have to focus on patient safety, therapy effectiveness, responsiveness, and care. To get those four things right, patients are going to keep swarming the clinic and they're going to keep coming back. You need to design and guide an effective system to become self-referential and run itself through effective checks and balances. Quality management allows you to do that. And ladies and gentlemen, an effective QMS drives virtuous growth of your business, which is necessary for business sustainability and transitioning, especially in healthcare. Thank you very much.
Thank you so much, Dr. Ajayi, for that amazing presentation. Okay, so I'm just going to go right into the question and answer session. So if you're interested in asking a question, please raise your hand and then we'll take it from the first. Okay. Elijah, are you still there?
Yes, I'm here.
Okay, I can't see any hands raised, so that's what just making sure that
Okay, we have some under the attendees.
Okay, so please just unmute the person.
Okay.
Please go ahead and ask your question.
So I've allowed Modupe to speak up.
Hello.
Hello, Modupe, you can speak now.
Modupe.
Maybe you can suggest to type it in the chat and then you can read it.
Yeah. Yes, please. So if you want to ask a question, you can also go ahead and type in the chat box and then we'll read it.
Hello, good morning.
Hi, good morning.
Yes, thank you so much for this webinar, Dr. Ajayi. I particularly enjoyed your session. I have a question to ask if you don't mind. So beyond strategies and processes, I'm one person that believes that the mindset of the healthcare professionals and even all staff in the organization plays a major role in incorporating quality management systems. I believe that having that patient-centered mindset when you are providing care helps in incorporating quality management. So what advice would you give to leaders who are trying to encourage staff to have the mindset of patient-centered care and providing quality care to patients by focusing on the fact that patients are the center of care? What advice would you give to leaders that are trying to encourage this mindset among their staff? Thank you.
Thank you very much. That's a very good question. And I think it's very pertinent in Nigeria. Because my experience is that, most nurses and doctors that come into our private organizations usually come from the government hospitals, where the focus on quality is not as, as robust as it should be. Basically, the mindset is that we're doing the patients a favor. We're providing a social service. And so when they come into your organization and you're trying to get them to focus on customer service, there's always a challenge. And you just got to keep training. Our first thing is to make sure that, you test for these willingness at interview, because sometimes you employ people who are totally intransigent in moving in this direction. And if that's the case, you need to be able to help them get other opportunities, because you have to deliver customer service. So it's about engagement, ensuring you recruit people that are right, and then engagement, training, retraining, and make it a non-negotiable. Respond to customer service complaints, listen to the customers, doing opiniometers, and using it to run the organization. So you have to just work hard. It's hard in Nigeria because most people are not used to it, but it's the only way we can deliver quality healthcare. Thank you very much.
Thank you so much. That answers my questions.
Thank you, Fatima. Is there any other person? I have a question on the chat box by Yashawin. She says, quality management system principles are from ISO 9001, or are they applicable to all the quality management certifications?
No, they're not. I mean, you see, when you can sit down and look at this, if you look at all the accreditation standards, the philosophy is the same. They may call them by different names, okay? But the philosophy is making sure you look at the processes. When you get to things like JCI is more about sort of committees and looking at things and things from a point of view of how can I describe it? It's more it's looking at more multidisciplinary. That's what I'm looking for. Get a multidisciplinary approach running. So, but the philosophy is the same across all standards, but the nuances and specifics are a bit different. But the philosophy is the same.
Thank you very much, Dr. Ajayi. Are there any other questions? Somebody else? We have just 1 minute and we can take a very short question. If anybody wants to put something in the chat or raise their hand, and Elijah will unmute you. So everybody's asking for the presentation slides, Dr. Ajayi, so I'll reach out to you.
I'll send it to you. I'll send it to you, and so you can share it.
Okay.
So, Dr. Ifunanya, I have a question.
Hi, Dr. Hi, PBT. Good morning.
Yeah, and thanks, Dr. Ajayi, for the presentation. Really appreciated. Can you share some practical tips, on how, in your experience, you believe leadership can remain strategic in their QMS approach in order to avoid firefighting, especially in situations where things don't go in line with the plans that they've initially set?
Well, I think a plan is there to guide you, and it's rare for things to go perfectly to plan. But when things don't go to plan, it's a question of understanding why it hasn't gone and putting systems in place to rectify that. In my own experience, I started life thinking quality was a certificate, and I put it on the wall and was very proud of it, but realized you needed to do more. Because I remember in the early days when they did the audits, I used to be present at every audit because I knew all the answers in my head. But after a while, I realized I needed to disappear and let the people answer, because that's when you know when people are doing the right thing. And it was not about passing the accreditation. Sometimes it's good to fail the accreditation so that you know that these are the gaps that you need to fill. So that aspect of just letting go and letting the system breathe and let people just do their work. So when the auditors come and sit in front of your front desk and they spend half an hour asking her about SOPs, she has to be able to answer it. That's how your business gets stronger. So it's not about the quality manager being there all the time. No, the quality manager too should disappear during the audit and let the rawness of the organization be seen, and know that that's what you need to fix for next year. So that's what I learned. Just let the system run itself, and it gets stronger with time, with you focusing on this is where you need to get to. Thank you very much. There's one more question.
I can see there are more questions, but I'm not, okay, because I know you have to drop off. I'm just going to extend this a little so that you can take all your questions now. Is that okay?
That's fine. I have another 10 minutes or so.
Okay. So some Gift is asking what happens when it's a supposed leader who is failing at their own responsibility in terms of quality management.
Well, I don't know what you mean by a supposed leader, because not all managers are leaders, and not all people that are put in positions of responsibility are leaders. So maybe somebody has been put in the wrong place, and that's a problem someone needs to solve. But a leader is a leader. A leader is somebody that influences you. A leader is somebody you want to follow. A leader is somebody who has a vision, who can inspire you to see their vision, and keep you going. So I think those are challenges that we sometimes have, because sometimes in healthcare we use tenure to guide promotion, and a lot of people get promoted to positions they have no reason for being there. But if the people that are driving the system are clear, then you should be able to either make sure they have the right level of training if they have the aptitude, or help them get a better opportunity somewhere else. Thank you.
Thank you, Dr. Ajayi. And the final question of this session is from Dana Liu, who is asking that, what is the biggest challenge you've encountered when you're trying to implement QMS in your organizations, and how did you manage it?
Well, the biggest challenge is people. People. Like I said earlier, I realized the importance of having a quality management system, but that doesn't mean everybody working in the organization realizes it. So it became my responsibility to make sure people understood it. So we set up things like every Tuesday we had clinical sessions where we discussed everybody coming through, and then we had staff development sessions, which is all about training. Why do we exist? What's the purpose of our business? Why do we need quality? Why do we focus on this? So it's a question of just training, and being also clear, because not everybody believes in what you believe in, because we all come from different backgrounds. And if you encounter people that are intransigent in their inability to move in the direction that will help the organization, then you need to deal with that. But people have been the major challenge, and it's an ongoing project. Thank you. Especially what I'm dealing with now, because we're in a teaching hospital, and LASUTH is a different philosophy, and it's important to have everybody on board, and we're blessed with a good chief medical director who understands the importance of this, and the DCST also, who's now driving it down. And if they get it, then the rest of the organization eventually will get it, because it's their job to drive it. And so it's work in progress.
Thank you so much, Dr. Ajayi, and thank you so much for being our first speaker and setting the tone for this engagement. It's been awesome hearing you speak again. So thank you very, very, very much. And we hope that we'll be able to do more things together in the future.
Thank you very much. It's been a pleasure being here, and I'll stay for a bit longer. Thank you very much. Bye-bye now.
Thank you, Dr. Ajayi. Okay, so I'm going to share my screen again while I read out the intro for the second speaker. Sorry, just give me 1 second. Can you see my screen, please?
Yes.
Awesome. So our second speaker for today is Adam Thompson, who is the President and Chief Executive Officer at EHA Clinics. He is the CEO and co-founder of EHA Clinics, which is a chain of clinics he co-founded to bridge the gaps between patients and primary healthcare service across Nigeria. EHA Clinics is designed to enhance the patient's experience by diagnosing and treating patients based on a systematic, evidence-based approach while providing high-quality, affordable care. Adam's passion for quality healthcare management has led him to implement a holistic health information system at EHA Clinics, including electronic medical records, telemedicine, appointment bookings, and billing. He's also led the implementation of exceptional corporate culture, including the training and implementation of crucial conversations, lean healthcare procedures, and best practices. Prior to founding EHA Clinics, Adam co-founded eHealth Africa, a public health nonprofit organization where he currently serves as board member. He holds a bachelor's degree in information system management, information systems education, and sociology from the University of California, Santa Cruz, and has attained a global executive training in integrated care at the Center for Healthcare Management at Columbia University. Since bagging a certificate in impact investing in Africa from the University of Cape Town Graduate School of Business, Adam has gone on to co-found EHA Impact Ventures, the philanthropic impact investing enterprise, where he also serves as president. So, ladies and gentlemen, it's my pleasure to introduce my CEO, my mentor, my boss, Adam Thompson, to talk about leveraging technology in quality management systems. So Adam, I'm stopping my share. Please go ahead and share your screen. Awesome.
All right, excellent. Thank you, Dr. Faya, for the introduction, and Dr. Ajayi for that brilliant introduction and conversation. Quality and patient safety is really at the heart of why we started EHA Clinics in the first place. And I wanted to kind of build on the first speaker and discuss some of the ways that we thought about quality and patient safety at EHA Clinics as a way that we continue to both build our business and expand the types of care that we can deliver. So I've been asked to talk about leveraging technology for quality management and patient safety. And I'll start with just a bit of an introduction and talk about kind of, again, our framework for that. So technology and patient safety is really around, to drive kind of a handful of different things within the system. It's about reducing medical errors. A lot of technology and patient safety focuses on drug safety. So, getting the correct prescription to the right person, looking for interactions, all these types of things. Remote patient monitoring became really important during COVID as a way to enhance patient safety, to kind of keep, people that were infectious away from people that were relatively healthy or didn't have COVID. And virtual care also supported that. The other things that where technology really drives patient safety is around just improving lines of communication and this increased collaboration among providers, whether there's physicians or nurses or other team members. I just put these two links in here, and I'm sure when you get the presentation or the recording, I do think going back and looking at some of the core work on patient safety, and that was done, the original kind of 2000. In the year 2000, the study To Err Is Human, that fantastic paper that really kind of sets the standard for this shift and how we think about quality and patient safety in healthcare. And then this high quality health systems and sustainable development goals, this era for a time of revolution. We highlight quality as being, like Dr. Ajayi says, really instrumental and core to healthcare. There's really no point in providing access to healthcare if there isn't the quality there. The last study that I just mentioned in the Lancet, it highlights these really critical and devastating statistics around there was in 2015 they highlighted 1 million excess neonatal deaths of people that had access to healthcare, had access to the healthcare system, but received poor quality care. And it's those types of things that we were hoping to kind of transform by building a culture of quality and patient safety within EHA clinics, and hopefully within the healthcare environment as a whole. I'm going to cheat a little bit. I'm supposed to talk about technology, but the first, I think, 3 parts of improving patient safety with technology is culture, culture, and culture. You know, this comes up a lot. I mean, we've got our SOPs, we've got our systems, you know, there's cool tools that we can deploy to make some of these systems work better. But if there isn't communication, openness, transparency, if there isn't a culture of teamwork and coaching, if there isn't a culture of continuous learning and problem solving, none of that will matter. It will just be a certificate on the wall, or SOPs that get filed away. And we want to move past that. We want to really, you know, develop a system that really enhances quality and patient safety. And the way that we do that is by getting the right people on board and the right culture in place. And sometimes that's teachable, but we've also learned that in some cases it's not always teachable, and you have to be able to filter out those you know, those staff members or those coworkers that just aren't on board for that type of culture. And then, you know, then the kind of crux of the things, data provides really the core framework. So however you're collecting data, typically nowadays it's obviously built around some kind of EMR system, but I don't think, I mean, if you're running a small clinic or working in a small clinic, you don't have a budget for an EMR, it doesn't matter. Use Excel. It's the process of starting to record events and collect data that will lead to some of these other things. Frameworks, guidelines, standard processes, these are things that technology can help drive, but they need to be in place first. There's lots of tools, which I'll get into. You know, these are developing all the time, really bringing quality diagnostics closer to the patient so that the providers can make decisions faster and make interventions more quickly in the diagnostic process. And then communication, whether that's provider to provider communication or provider to patient communication, enhancing those communication pathways and improving those communication skills and tools are things that will drive patient safety and quality. So again, starting out with just culture. Culture and, you know, we look at communication and teamwork as being the foundation of our quality management systems. And this comes up all the time. So one of the things we started out with is, okay, well, we want to implement quality. That's fantastic. So we needed to start somewhere, and we wanted to start with making sure that our management members, our leads, our staff had the skills and the tool sets to communicate, you know, to communicate openly and productively. And so Crucial Conversations became a good foundation for that. I think it's a great resource. There's lots of research that shows how some of these impact of some of these communication skills have improved patient safety. The Crucial Moments in Healthcare is a summary of some of that, where it looks at the, you know, these barriers to communication and how those ended up impacting patient safety. Simple things like a nurse being too afraid to point out an error to, you know, a senior physician or a surgeon. Those types of things lead to critical errors. When that nurse or that nurse tech is comfortable going to the surgeon and saying, hey, I saw this, I think we should stop. There's a problem. That completely changes the game, and it means that everyone's focused on, okay, the real core goal of this is safety and quality of how this patient's receiving care. And it's really about not just communicating, but really communicating in such a way that develops this kind of shared understanding and the shared meaning, and then translating that into action. These are all great resources that I do recommend that everyone kind of pick up and look at. Regardless of the field that you're in, at the end of the day, it doesn't matter if you're a doctor, a nurse, a lab scientist, an optometrist. You know, these types of skills within the healthcare environment are what's going to, you know, get us to kind of our ultimate goals. The second really kind of, or this third really kind of important part of culture is this continuous improvement, continuous learning, and problem solving. Like we don't get to quality by, you know, just completing an audit. It's, you know, it's really about these kind of incremental changes and systems in place that help us kind of make improvements every day. Obviously, we want to get to the system where we're not repeating the same errors all the time. We want to, adopt this continuous improvement. The system for lean healthcare, lean kind of came out of the manufacturing industry, where it looked at, how do they empower teams to make these small improvements, at the front line. So you didn't have to, if you wanted to make a change that improved quality, you didn't have to, run it up to management or the CEO to improve that. The team had the resources, the tools, the empowerment, and the guidelines to really enact that change at the front line. And that's, again, another kind of big component of driving quality. At EHA Clinics, when team members decide that they need to make an improvement, they don't have to call me. They don't have to send me an email. I don't even have to sign off on it, right? They follow their guidelines. They know their mandate. They know their budgets. They know these things. They can take those tools and they can make change that improves quality, and they can document it and evaluate it, and all without having to pull in senior management to get approvals, because approvals just slow down processes for improvement and for quality and for patient safety. Kaizen is a big part of that lean system. And again, it's about these small improvements that we can make and that we can repeat, and that where everyone really gets involved in this. It's not about passing improvements down from management. It's really about getting everyone involved, figuring out what the problems are at the front line. And this not only just involves like getting the involvement of the staff. Sometimes this involves, bringing in patients and seeing what the problems they're observing are in the system, the challenges they have. We use lots of language in the health system, like non-compliance, when a person is not taking their HIV meds or their hypertension medication. But if we change that that frame of non-compliance, we say, okay, well, actually they're experiencing a problem and a challenge taking these drugs. What is it? How do we remove those barriers? How do we improve that process, instead of just kind of labeling non-compliance and moving on? It's really about seeing that as a problem, seeing the patient as a stakeholder to that problem, and then working on a solution to fix that. I really, was inspired by Atul Gawande's The Heroism of Incremental Care when looking at primary care as well. There's this great kind of framing that they use in the book, in the article, and some other related articles, where they talk about healthcare versus this health cure. So much of primary care is actually about just kind of getting someone a cure as quickly as possible and getting them home, right? Whereas care is really about kind of, understanding that we're not always going to arrive at the cure in that first visit. We need to kind of know what the patient's going through, build a relationship. And sometimes it takes a while to arrive at a diagnosis and a treatment that works for somebody. Because not everything is just someone has malaria, give them tablets, send them home. Some things are much more complicated than that. And you've got to evaluate things like their mental health and their family situation and all these other things that really arrive and build the kind of complete patient, not just this disease or this infection that we're trying to cure. We need to kind of see the patient as a whole and really kind of make them a stakeholder in this kind of healthcare journey that we have. And again, when we do that, we deliver better quality care. We deliver better patient safety, because we're not just trying to rush towards a diagnosis and rush towards a cure. We're really trying to evaluate all the different kind of aspects of the patient and how to bring that into the healthcare plan that we develop. When we talk about the kind of technology aspects and where do they come in to patient care, I like to look at this kind of diagnostic process map, because what's really important is seeing every part of this has some kind of aspect where we can improve, we can put systems in place to improve both the data collection that we might have, the technology that's available. So from when the patient experiences a health problem, how do they get that to us? How do they communicate that to us? How do we make it easier for them to engage with the healthcare system? Then once they're in the healthcare system, all the information gathering, the information integration, interpretation, the physical exams, diagnostics, all of these are areas where we can look at and system by system say, okay, well, how do we leverage technology to improve the system? Obviously, the communication of the diagnostic, the treatment, that cycle, and then how do we actually monitor outcomes, and how do we know how our patients are doing after they leave our immediate, vicinity of care? How do we kind of remain engaged in their care afterwards? And so, I think when it comes to applying tools and technologies and systems to healthcare, it's really important to think about the entire framework systematically. And so you're not just, biting off pieces. You're really saying, okay, well, how I'm going to implement, if we're implementing technology to improve how patients engage with us, how are we then going to link that into these other systems, and how are we going to update our workflows and processes to really make the most, efficient use of that? I mentioned, that the other steps that I think are important in improving safety. Data, as I mentioned, is the biggest one. This is just an example. We work with Better Care, which is they have this data platform. So we use their data platform to kind of keep all of our data about patients and everything kind of related to that. And if you don't have that, then you can't do all of this stuff on top. If you don't have data, you can't then figure out build that data into workflows and reminders. You can't develop those clinical dashboards, targeted at specific areas. Then you can't develop those integrated services and so on and so forth. So looking at that base of data and saying, okay, well, how are we going to get there, and how are we going to then integrate that into our processes? So you've got to start somewhere. Obviously, starting with a good EMR system is a great way to start. But like I said, if it's Excel, or if it's some kind of structured data system to start with, then that's fine. It's really about getting that data, recording it, and then figuring out how you're going to leverage that to build some of these more intelligent systems and processes. The second one I mentioned was about guidelines and standard processes. I think, there are so many. Just going through the JCI accreditation process, you end up, managing thousands of SOPs at the end of the day and guidelines. And it would be really wonderful if we just all had the brain space to hold those all on our head all at the same time. And some of us can. I'm not one of those people. So what we've tried to deploy at EHA Clinics is tools that provide quick access to those guidelines and those best practices and those tools and calculators and other types of practice supporting things. We work with BMJ Best Practice to provide those libraries. We've got mobile apps and tablet apps and websites. So in between patients, our team members can look up particular disease area, look at what's the latest evidence, if anything's changed. There's even communication tools. It's not just about diagnosis and treatment plans. It's also about, well, what's the best plans for communicating this to our patients. And so there's guidelines for communications, there's pamphlets for sharing with patients that have certain conditions. And that's been a really, really fantastic resource that just by providing that to our clinicians and our staff has really opened up a ton of access. And just, moving that process along of instead of someone sitting there, worried about, if they're following the SOPs or have the right guidelines, they can quickly access them and really kind of advance patient care. I think, again, having a framework for, and strategy, from that kind of quality management system, that quality assurance standpoint. At EHA Clinics, we kind of started our framework based on this building blocks approach. So it's called the 10 building blocks of high performing primary care. What I really like about this is there's this kind of the 10th building block. So it's the last, it's the last piece. There's all these things that you really should focus on, and you don't necessarily need technology to drive it. It certainly does help. And in the changing world and the changing ways that people are accessing technology, I think this is becoming more important, but really all those other things have to be in place first. You're not going to do a great job delivering technology if you don't have, team-based care, if you don't have a plan for empaneling patients, if you don't have comprehensiveness and care coordination. These technology things are just going to be there, and they might be shiny and nice, but they're not going to really drive patient safety and quality if you don't have some of these building blocks in place first. But what is important is that our healthcare system's becoming more burdened. We have less doctors and less nurses than we did yesterday. We're seeing more patients. We're having more complicated, longer term care with non-communicable diseases, cardiovascular disease, cancers, other types of things that need this kind of longitudinal care, follow up, and ongoing management. Those don't all need in-person clinical visits. So we can use technology to expand the amount of patients we can have under management and that we're caring for without having to, book them all for 15-minute visits with a clinician. We can be more creative about the systems that we put in place so that those patients can receive the ongoing care that they need in support and management without necessarily having to depend on having space for in-person consultations. So I do think that that's a really key, and that's going to be something that's an ongoing piece. But I can't emphasize enough that in and of itself, having a telehealth platform, so you can WhatsApp a doctor is fantastic. If all that stuff, if those other 9 building blocks aren't in place, then you're just chatting with someone on WhatsApp, and that's not going to deliver the quality of care and patient safety that we really want to see delivered at the end of the day. Also, within the kind of guidelines and standard processes, there's a bunch of so Society to Improve Diagnosis in Medicine, keeps a library of these types of tools and technologies that have been implemented to improve patient safety. So these are 4 that they have on there. One of the ones they focus on is how algorithmic care for certain complicated diseases has really, or conditions, has really helped drive increased outcomes and patient safety. I wanted to highlight here that's really important, is they have all these notes, and each one, when they do an analysis, the first thing they highlight about how to implement these systems is culture. So they're down in red. The first thing that you need to do is make sure that the culture is in place to actually use these tools effectively. Otherwise, there's almost no point in starting, because it's not going to have the type of impact that you want it to have if you don't have this group understanding that adherence to algorithms and adherence to protocols is going to improve our patients' outcomes at the end of the day. If there's a resistance to protocols, if you've got doctors and carers that think that the guidelines are too strict and they can come up with better ways, then this isn't going to work, and you're going to have this massive variability in care that you can't manage, and then you can't really analyze and improve at the end of the day. The last thing I wanted to just speak on real quick is just the tools aspect. I think, 2 more tools. So we spend a lot of time, talking to manufacturers of technologies and lab tests and seeing, what are they doing to bring their tools and technologies to the point of care so that our doctors, our nurses, our healthcare workers, our social workers can actually, start participating in playing a role within the healthcare system. For example, if you're running a community clinic, you could say, well, this is my initial diagnosis, but you've got to go over to the lab, and in a couple of days or a week, maybe I'll know what's wrong with you and you can come back. But we worked with the HEMEX to develop the Gazelle platform, which focuses on malaria and sickle cell disease. So even if you don't have your own lab or you don't have access to a lab, you can run this device on your desktop, manage the samples yourself, get results within 30 minutes. So it just kind of cuts out that kind of round tripping in healthcare, gets you closer, to providing answers to your patients and the people that you're caring for without, if you're in a place that doesn't have the kind of quality infrastructure that you need to run, a test for sickle cell or malaria. Same thing with point of care ultrasound. These things are becoming easier is not the word. They're becoming more convenient to use at the point of care. There's some guiding technologies that are helping, again, doctors, nurses, patient care assistants do some of this initial diagnosis and collect some of this data on how patients are doing earlier in the process, and make that more convenient. They can be used in the field. They run on batteries. You don't need a lot of infrastructure to do this higher end care now. And things like, like the eye breast exam, which is an interesting tool that's basically just shown to, be a large improvement on the kind of physical exam, especially for kind of lower skilled or lower cadre skilled of staff that don't have a lot of experience doing breast exams. The tool guides them. They basically can't mess it up, if they use the tool and follow the app. And again, it just gives you some consistency in your diagnostic process so that you can manage more patients quicker and then know that you're having, you build in some of these kind of quality assurance and quality control processes into the tools. There's tons of these, and there's more point of care tools that are coming out every day. And I do think they're enabling us to do more with the same amount or less infrastructure and less human resources as well. The final thing, again, is on communication and all the different ways that we try and communicate and provide tools. So at EHA Clinics, one of the things we wanted to do early on is make sure that our patients have access to their own health data and they can communicate with our team when they need it. So our patients, we use this HealthMate app and put it on their phone. They can see their lab results. They can see their prescriptions. So if for some reason they've lost their prescription or forgotten what it was, they can quickly access it, open up. If they have a question about it, they can chat with the doctor or pharmacist directly from the app. So it just kind of closes that gap on the communication and hopefully kind of drives people to, instead of kind of guessing at what something might be, ask a question and get clarification before making a decision based on something they maybe Googled. The other part about communication is we tend to sometimes as professionals to kind of assume when our patients, our customers come in, they know what's wrong with them and they can communicate that clearly. What's shown over and over again, that's rarely the case. And it's more often than not that patients have difficulty in communicating what they're feeling and what is wrong with them. And so there's all these great communication tools, again, for patients on the Improved Diagnosis website that kind of gives worksheets for patients to, actually process what they're thinking and what they're feeling so they can put those down and then have a more productive conversation with their provider at the end of the day. Those can also be converted to technology tools. When people are booking appointments, you can have them do this first so that you have that data. So when they come in, you could really kind of kick off the conversation and really kind of get to the crux of the matter more quickly. And again, there was a great tool called Open Notes that was piloted across Kaiser Permanente in the US and a bunch of healthcare networks. And it basically just let patients, especially chronic disease patients, have access to their patient notes on this platform. And what that drove at the end of the day, more kind of understanding, because people could review them and kind of get a better understanding of why they were on a particular care plan, not just that, oh, they were told to do this and they don't know why, and so on and so forth. And that's been an interesting outcome of a relatively simple technology addition of just making sure that some portion of the notes were shared with patients. And again, just to highlight, the number one thing that made the implementation of those open notes tools successful was culture. And that culture of communication and transparency. Without that, doctors or other carers are hesitant to use this tool. They thought, that there might be kind of negative feedback, the way they wrote their notes and other kinds of things. But if the right culture is in place and you're sharing, things with this, openness and transparency and goal to kind of engage patients in the quality and safety process, then that can be truly transformative. Thanks, Dr. Ifunanya, for obviously the invites and introduction, and I look forward to your questions or comments, and thank you for the time.
Thank you so much, Adam. Sorry, I'm just trying to. Thank you so much, Adam, for those amazing notes. If you have a question, please put your hand up. Elijah will unmute you. We have the space for 2 audio questions, and then we'll take the questions in the chat box. So you can put your hand up now. Give it another 30 seconds. If not, I'll just start reading out the questions in the chat box. Hi, Fatima. Good morning.
Hey, thank you so much, Adam, for that presentation. I wanted to ask, I know it's very difficult to put a price on patient safety. So I want to ask how one can determine the relevance of certain technology. I mean, there's new technology coming out every day. So how does one determine how relevant a technology is in healthcare, quality management, and patient safety? How do you make sure that you're not just introducing waste or over-processing? Thank you.
Yeah, I think I think that's a very, very great question. And I think, a lot of work and evaluation has to kind of go into these. I don't like being, we're very tech focused, but I don't always like being, the early adopter. I like to see things that have been studied and evaluated so that we can see how they might fit our practice. Yeah, so I think, unfortunately, it does just take a lot of work and a lot of, getting references, seeing how things are being used, looking at case reports, seeing, looking, asking for the data, when these tools come out, the asking for the data, looking at the studies that have been done around these tools being used at the point of care. And I think, unfortunately, there's no shortcut to it. It takes a lot of reviewing and processing to get to those answers.
Okay, thank you very much.
Thank you, Fatima. Is there, we can take one more question online, audio question. Okay. If there isn't one, I have a question on the chat box. He says, my question here is, what will a lab technician do working in a private lab and his boss refuses him a chance to express his learned knowledge?
I don't. Yes. I think, unfortunately, the healthcare system has a lot of issues with quality. And I think that the majority of us have probably worked in a system that doesn't have those quality management systems in place. And again, I think going back to the first presentation, a lot of kind of quality systems are kind of seen as those kind of nice to haves. They're kind of seen as like, well, this is something that we do for rich people or something. They're not seen as actually integral to developing technologies. And unfortunately, that's a mindset that needs to be broken and needs to be changed over time. And if your boss is not there, then your boss is not there. And I think either you look for one that is, or you try and use your soft skills to lobby and make the arguments for those changes.
Yeah, that's fair. I have Mark who's wanted to ask a question. Mark, you can go ahead. Hello.
Hello, good morning.
Hi, good morning, Mark.
Yeah, my name is Mark Bookmany. I have a few questions to ask. Well, when he was explaining the tools, I was not hearing very clearly. As per those of the point of care for breast examination and that of the point of care for malaria and the sickle cells, are the tools downloadable maybe through our phones, or just we enter the site to get the actual quality, or how are we going to assess them? Thank you. Hello?
I think the question was, how do you access them?
Yes.
Oh, I put the links to the different sites on there. So the way that you access them is most of those tools that we're using have some availability in Nigeria. There's actually been a couple of the studies published for like the iBreasts were actually done at Nigerian universities. So I think from the websites, from the manufacturers, you can find out who's the distributors, who's doing the service, who's doing the training, and then get access through that way.
Okay, thank you very much.
Thank you. I'm just going to read out 2 more questions and then we'll conclude this session. So someone here is asking, sorry, there are a lot of questions. So how do you see making a Gemba walk a behavior and a habit when it comes to leadership in healthcare?
Yeah, that's a good question. So for those that don't know what a Gemba walk is, it's a term for basically, when they kind of studied healthcare systems, they realized that sometimes the closer the managers were to where the healthcare was provided, they had often, with the right processes in place, they had better kind of access to identify and address problems. There was a really interesting example of a hospital that kind of built their kind of main unit, and then they renovated their management offices and like moved it down the street, and patient errors and quality errors increased during that time, and patient outcomes got worse. And so eventually they realized that kind of distance to the frontline providers was a problem. I think some of that is a little bit old, because some of that is solved by technology. Not everyone can be, in the place, but I do think that people that are in a management space, a lot of times when you become a manager, your first thing is to kind of be like, well, where's my office away from all of these people? And I think, unfortunately, in healthcare and in quality systems, and it's not just in healthcare, like lean processes in manufacturing and other types of systems really are important for managers to kind of have experience in the workplace, know what's happening there, be able to kind of spend some time, walking through that space and looking at and seeing and hearing from the frontline workers what's going on directly, not just sitting in an office waiting for those reports to come in and making decisions that way. So I do think it's really critical to fit in, whether it's virtual kind of Gemba walks, or if it's kind of the managers kind of in person being there, and just really having access to the frontline staff to get that feedback more quickly.
Thank you so much, Adam. I know there are a lot more questions here. We're going to have another session at the end of the presentation to go through a lot more. So please just keep putting in your questions in the chat, and we will address all of them at the end of the session. Thank you so much again, Adam, for that excellent engagement. And thank you for your time. And we're just going to go right ahead to our third speaker. I hope you stay on the call because you have a lot of questions here. All right, so thank you. I'm just going to share my screen again and introduce our third speaker. Okay, I'm assuming everybody can see my screen. Awesome, so I'm introducing Dr. Anthonia Shagaya, who serves as our Chief Medical Officer and Vice President of Clinical Services at EHA Clinics. And she's responsible for the strategic and operational leadership and the delivery of world-class quality care consistently across all our locations. She also oversees the organization's ongoing medical expansion across the country. Before joining EHA Clinics in 2018, Dr. Shagaya served as the head of the pediatrics department at Nisa Premier Hospital in Abuja, as well as the senior pediatrics consultant. She chaired multiple committees, improving the quality of patient care delivery, and co-founded and ran the Sickle Cell Disease Clinic. Dr. Shagaya's passion for sickle cell disease led her to form Sickle Cell Well Africa Foundation, a non-governmental organization aimed at promoting the health and well-being of people living with sickle cell disease. Dr. Shagaya holds a medical degree from the Pennsylvania State University College of Medicine and a bachelor's degree at the State University of New York Purchase College. She completed her pediatrics training at the Long Island Jewish Hospital Systems, with subsequent subspecialty training in pediatric infectious disease at the Children's Hospital in Montefiore. Dr. Shagaya is currently pursuing a master's in public health at Johns Hopkins University Bloomberg School of Public Health. So ladies and gentlemen, without further ado, I'd like to welcome my boss, my sister, another of my mentors, Dr. Anthonia Shagaya, to talk with us about the theme of this year's medication, the World Patient Safety Day, which is medication without harm. So Dr. Anthonia, over to you.
Okay, thank you so much, Dr. Ifunanya, for that introduction. Good morning, everybody. Let me go ahead and share my screen. Sorry, 1 second. All right, can everyone see my screen?
Yes, we can, Dr. Ajayi.
Okay, perfect. So good morning, everyone. Once again, I would be talking about medication without harm, which is the theme of the International World Safety Patient Safety Day. And I will be talking about it in the line of setting up a medication management system within EHA clinics. You know, as healthcare providers, one of the things that we, sorry, I'm trying to move to the next. One of the things we do, you know, we've all taken the Hippocratic oath of not doing harm to patients. So this topic is actually apt in what we're doing. So I'll be going through just an overview of what medication errors are, the scope of the problem, some of the economic and health implications. And I'll be talking about causes of medication errors, and then walking us through just how we went about setting up the medication management system at EHA Clinics through the PDCA cycle, and then just concluding on that. So medication error is any error that is preventable. So it's a preventable event that may cause or lead to inappropriate medication use. A lot of times we think that it has to cause an adverse drug event or an adverse drug reaction, but it doesn't always do so. Right, so medication errors are can be near misses, can be intercepted errors, but they can cause or lead to inappropriate to harm. And we have the medication cycle, the medication use cycle, right? When in a healthcare system, usually medications are selected, they're stored, and in that process, you know, there's the evaluation by the clinician, an order is made, they dispense medications, is administered. Either through the nurse or the pharmacist dispenses the medication. And there's some education and training of the patients on the proper use of the medication, and of course, monitoring. Errors occur where there's an unintended failure in this cycle or in this process. And this can also lead to patient harm, as I said initially. So I just want us to walk through some of these classification of medication errors, right? So, you know, there's the first line, it could be a clinician, it could be the doctor, the nurse, it depends on your healthcare facility who has the access to actually prescribe medications. And looking at the top box, the action can start from one person. The error can occur from prescribing, or the error can occur from dispensing, right? But then an error occurs. And then that error actually gets through to the patient and it causes the patient harm. And this is error with an adverse drug reaction. The second scenario is where, you know, in the process of ordering that medication, or again, to the clinicians, the error also gets through to the patients. But in this case, there's an error occurs, but there's no harm. So this is error without any adverse drug reaction. The third scenario is where an error does occur, but before that error gets transferred to the patient, it's actually caught and stopped. And this is an intercepted error, sort of what we call sometimes a near miss. And then the fourth scenario is where, you know, an order has been made, the action has been taken, and before, you know, the prescription is being made, maybe the pharmacist realized that, you know, they picked the wrong medication and they put the medication back. And this is a potential error, or in the way that we organize our medications, you put things together and you notice that this is an easy way for an error to occur. And when you look at your processes, you might see that an error could occur. So this is what we call a potential error. So what's the scope of this problem? About 1.3 million are affected annually in North America. And there were statistics actually that were shown that every day a person dies from medication errors. In Europe, about 237 million medication errors are reported, with 66 million having clinical significance. So that's a huge problem. In low and middle income countries like Nigeria, the problem is not well studied, but it's also thought to be in the same you know, magnitude that we have this medication errors. It's just that it's not properly studied, so we don't really have good statistics. are in medication errors, even though we might be on par with the same statistics at the rate at which medication errors occur, it actually has twice the impact that it does than on other countries. There's some studies done in Nigeria, retrospective studies done across the country, where it reported the percentage of medication errors at 47%. There were also other smaller studies that were also cross-sectional, maybe within a particular clinic, like an HIV clinic or so, that actually put the prevalence between 11.9% and sometimes as high as 75%. So this is not just medication errors that actually cause an adverse drug reaction or an adverse drug event. These are also just medication errors, maybe omissions or where they dispense the wrong medication or whatever the case may be. So it's putting everything in totality, because I know 75% seems like very high, but it's also just, it's talking about all the possible ways that medication errors can occur. When you're looking at this, I want you to keep in the back of your mind, what do you think is the cause? Like, what drives these medication errors within the healthcare environment? So it doesn't just have implications on the patients, it also has implications for the economy. Medication errors can cause a high morbidity and mortality costs, about $77 billion per year. That's a really huge amount. And then, errors can also estimated at 42 billion annually, which is almost 1% of the total global health expenditure. There are effects that happen when medication errors occur, right? You can have, as we said, from no harm, where Medicaid errors are get through to the patient, but it doesn't cause any harm to the patient. But again, we can have things like adverse drug reactions, drug-to-drug reactions, and issues where even patients don't comply with their medications because they're experiencing, events from the medications that they've been prescribed. Preventable medication-related hospitalizations, and of course, what we all fear is death of the patient. That can also occur. There's also a disability that can occur through medication errors, and this is something that we need to keep in mind. And this is why we keep talking about this, because it's really important. So what are some of the factors? I said keep in mind some of the things that you think that are related to patient errors, and some causes associated with some of the factors. So the first one is healthcare professional factors, right? So let's say, the healthcare professional has a huge workload, they're coming in, there are tons of patients, they're trying to rush through their workday. This can cause medication errors. The level of training. So studies have shown that, younger you are in your training, so, younger doctors or younger pharmacists tend to make more errors than more experienced clinicians. Patients also are a factor. Polypharmacy, we have patients that have complicated medical histories that are on multiple medications, and this can also lead to medication errors. The medication itself can be a factor, right? How are those medications labeled? How are they stored? The work environment can also lead to errors. When a pharmacist is doing their job, but they're not in an environment where they can concentrate on a patient at a time, or there are multiple patients coming in. There's a lot of distractions, and that can also lead to medication errors. Imagine a pharmacy that is not well organized. Medications are in different places, and somebody can easily pick a different medication that they should. So the organization of the environment is actually also an important factor in contributing to medication errors. And I know we talked about information systems and how to leverage technology to reduce this, but sometimes it can be one of the causes when the process of generating a prescription is actually very difficult or tedious. It can lead to medication errors. So now I'm going to run through just how we went about setting up our medication management system at EHA Clinics. One of the things Dr. Richardson talked about is that quality is not a department. Yes, we do have a quality department that oversees sort of our activities within EHA Clinics, but quality is the business of everybody, we say this all the time at EHA Clinics, it's not the business of one department, it's the business of our organization as a whole. So when we even talk about setting up a medication management system, we go through the whole process of it's everybody's business. It's not just for the quality department. Some of the objectives is to improve the patient safety through determining and reducing the major causes of medication errors. We apply these preventative strategies in the hopes of being able to mitigate these. We also wanted to provide opportunities to reduce the effects of errors that could lead to future errors. Basically studying and warning others of the potential errors that could occur or potential risk of harm. And then to ensure that healthcare personnel provide quality and safe, reliable healthcare services for all our patients that visit us. So really, what's a medication management system? So, we talked about all these tools and supports, but it's a system that is used to support the improved quality, safety, and effectiveness of medication management in any healthcare setting. We run as a preventative care outpatient setting mostly. I know that people listening that work in hospitals, in bigger organizations, but this runs through whatever sort of healthcare system that you're in. So the entire process from ordering, storage of the medication, documenting and tracking, all these things are really integral in implementing a medication management system. So as I said, we followed this plan, do, check and act approach. And as we mentioned before, EHA Clinics got JCI accreditation, which was a big feat. And so one of the things that we did is just use some of these guidelines. We started by developing medication management use policies across the organization in our medication management system. So some of the things that policies that we looked at was safe storage and handling of medications. We instituted an antimicrobial stewardship policy. Just to mention that some of these, policies and things that we started with JCI were things that we started even before JCI, but this sort of helped us crystallize some of the activities that were ongoing. So, for example, our antimicrobial stewardship policy, stewardship program was ongoing before we even implemented JCI. So we monitor and track our antibiotic use and with prior authorizations as well. Safe medication prescribing policy, medication reconciliation is something that we looked into, and then medication error policy. As part of JCI, we have these international patient safety goals, and as far as it relates to medications, one of it is safety of high alert medications, and then safe use of concentrated electrolytes. So some of these, especially the patient safety goals, have like a benchmark that is 0. That's, there's no room for error in those, and they put those as a high priority. So these are some of the examples of safe storage and handling of our medications. So we, if you look at these two medications, you can see that they're really similar, right? So you can see how somebody can easily pick up one medication thinking that it's the other. So we label all our medications. So these are like sound-alike medications. So it's labeled with an SA, as you can see in both of them. And, for pentazocine is also a high alert medication. So it's labeled with our high alert sticker. On my right, you can see Voltaren. They're two different strengths, right? They look alike and sound alike medications. And so, those stickers are put in there for the healthcare, the clinicians to take a step back and look and see that these are things that, if we don't take care, it can cause harm. They're color-coded and labeled. And for these medications, we actually store them, 3 medications apart. So they're not allowed to be close together because, again, somebody can easily pick up that medication thinking that it's the same medication that, the healthcare provider prescribed. And one other thing is our concentrated electrolytes. They also call it color-coded because they need to be diluted before administered to patients. And so in this, when we're giving any concentrated electrolytes to patients, we also follow a 2-step verification process where either the doctor and the nurse verify, but at least 2 people verify And you can see also that potassium concentrate is also high alert medication, has been labeled as that. We also have access restriction to certain medications. High alert medications are access restricted. And then, you can see the sign where it says, double check. It's a high alert medication, you need to double check before you move along. As part of this process, we also, implemented the monitoring of these and checklists so that our pharmacists are able to keep track of what's going on. And they complete these checklists when they're going through some of these orders or medications before it's prescribed to or given to the patient. Our antimicrobial stewardship policy we implemented, as I said, even prior to JCI, we started where we created standard guidelines for antimicrobial therapies. We have benchmarks for inappropriate prescribing. So it's something that we monitor very closely, and the benchmarks that we look to hit. We also have prior authorization of some of our IV antibiotics, and then we also have monthly antimicrobial use audits just to track and see how well we're doing with antimicrobial prescriptions. Adam spoke about leveraging technology. So this is our EMR. So one of the things that we also had to look at for any good medication management system is to have elements within your prescription, key elements there to promote safe medication use. So as you can see, we have indication, dose, form, frequency, duration. These are all the things that are required in a good prescription to be able to promote safe use. We also instituted a patient identification policy. So we have a 2-point identification planning within EHA Clinics. So before medication is administered or given, you have to identify the patient using 2 different biodata. We also limit verbal orders to only emergencies. I know in some organizations, there are verbal orders that are given out. And one of the things we did was limit that to only when we have emergencies. And that needs to be taken care of quickly. But then after the emergency is done, all that also needs to be put into the system. And then we also have automatic stop orders. Medication reconciliation is also really important. We have patients that are on multiple medications, especially our geriatric patients. So every patient that comes in, the medications are reviewed at each step, right? So the nurse sees them, reviews their medications. The doctor also reviews that medication. The pharmacist takes the time as well to review the medications, if there are any allergies. This we do to prevent duplicate therapy and also polypharmacy. So this is also a very, very important step that we take before medications are dispensed to our patients. Medication error policy is something we also implemented. We have this incident reporting system that goes within our database. So every incident is either it be a near miss, any harm that was caused to the patient through medication misuse, even though there was no harm to, those are reported, and any adverse or sentinel events. We encourage our staff at EHA Clinics to report these incidents. So one of the, even Adam, one of the things he drove on is culture. You have to create a culture, and it's still a work in progress, but creating a culture where people are able to stand up and say, I made this mistake, or this is the mistake I caught. So a pharmacist is able to catch a mistake that maybe a doctor made. And one of the important things I want to really emphasize, and this is not for punitive measures, this is for us to look at what our processes are. Whenever these events occur, we actually go through a root cause analysis to see what we need to change within our processes to be able to make sure that this error does not occur again. So again, it's about the process and not the person. And so as I said, we encourage our staff to be able to report these things so that we're able to look at the process and make sure they don't occur again. Monitoring is vital. If you don't check, you will not know. So monitoring and tracking all these things are things that we take very seriously. We do monthly audits. We provide feedback for continuous improvements. So you need that data to be able to inform what you're going to do next. So to be able to drive that policy and continuous quality improvement, you need that data and feedback. So this is something we take very seriously. We do incident management reviews. And then we also look at our workflow process. We do that as the whole for the clinic as a whole, but we also do that in departments to look at whether our processes actually make sense, whether our processes promote safe care in our patients. So this is something we look at. And then we use multiple analysis tools like the root cause analysis tools like the fishbone diagram, 5 whys, and DMA-ICA. So these are some of the things when we say check. This is just an example of our antibiotic use audits. When we started, our benchmark is 10%, and you can see that we were doing really well. But we had to keep on going back and looking at and seeing what in our process would change, right? You start seeing that patterns will emerge when you're looking at the data. And one of the things we found out was as we actually onboard new staff, right, things change till they're comfortable with the process that goes on within the organization. But if you don't check, you will never know where you are within what you're doing. So this is something that we also do. I mentioned root cause analysis. So for every incident, for every medication error, whether it be near miss or one without harm, we go through this root cause analysis to see what the problem is and where we can make changes within our process. So we go through things like, we talk about the incidents, and then we go through things like environmental factors. Are there environmental factors that could have caused this error? Are there people factors? Are there policy factors that we need to change? Maybe there was, communication errors that occurred. And also, as high up as management, is there things in management that we need to put in place or we need to change that could also help in mitigating this in the future? After all this, if you don't act, then all your efforts and everything that you do is actually in vain. So we use these audits to drive quality improvement projects. All these, we have our members of the staff have visibility on the process and feedback. We give feedback to the teams. Sometimes it's weekly, daily, monthly. Depends on what we're looking at. But we make sure that this process is visible. This also sometimes causes us the need to train and retrain staff members, which is very important. There's ongoing education, and you can never learn, you can never be someone that knows everything. So training and retraining is really important. We also drive a culture of accountability, quality and safety. Again, I'm going to say that quality is not a department, as Dr. Richardson said. Quality is everybody's business. And I know we're talking about medication management, but really within every single department and with every single staff, this is something that we try and drive throughout every process. So in conclusion, patient safety is fundamental in delivering quality healthcare services. Medication errors can have a significant impact on the patient, right? It's ranging from loss in healthcare revenue to adverse drug events and also to death. And so these are things that are really important when it comes to patient safety. You can detect errors through active management and important also effective reporting systems. So that you can catch these errors before they occur. And the best one to actually have is an intercepted error, right, before it even moves down the chain. A good electronic medication management system also supports this improved quality, safety, and effectiveness of the medication management system. And again, I'm going to leave everybody with quality is everybody's business, and quality in medication management is very important, and our goal is no harm when it comes to all our patients. So thank you very much. I'm going to stop sharing and I'll hand over to Dr. Ifunanya.
Thank you very much, Dr. Anthonia. So quickly, we're going to go into questions. So if you want to ask a question over audio, please just put up your hands and Elijah will unmute you. I have some questions in the chat. I'll just give you 30 seconds to do that. Before I go to the chat questions. Okay, so I will just go ahead. So the first question is, the Nigerian healthcare system practices a punitive approach to managing errors, and this discourages healthcare professionals from reporting errors. How can leaders and managers of healthcare organizations break free of the punitive approach and create a culture that encourages people to report errors?
Okay, thank you for that question. It's actually a really important question because culture is really important, right? And one of the things I had mentioned in my presentation is when someone reports an error or we identify an error, we focus on the process and not the person. If you focus on the process, then it creates this environment where people know that, okay, this is not something that's punitive. So you look at the processes that are in place and go down the line. Again, it might be a people's process. Maybe there needs to be training, more training for that particular personnel that the error occurred through. Or maybe it's a process, failure. Maybe we haven't provided the right environment for the patient, for the staff to carry out the individual services that they need to. So looking at the process and really going through, you have to take the time to go through your process and do it, like even if it's a root cause analysis, to see sort of where the problem lies. And sometimes our assumption is that it's this individual that actually, the error occurred through them. But a lot of times it is not the individual, it's the process. And if you can change the process, it will stop it from happening in the next time, right? If it's something that's just punitive, and you say, okay, you've warned the person or you've talked to the person. These are things that you can look at in your system and, down the future, even prevent other mistakes from occurring or errors from occurring. So really it's looking at the process, I would say.
Thank you so much, Dr. Anthonia. I don't know if there's anybody waiting in the queue, Elijah, because I have a few other questions typed in the chat.
Yes, we have John Amos. He should be able to.
So please, John, go ahead. Hello. Okay, I'm just going to take the second question while John is trying to navigate. So the question is, like you said, quality is non-negotiable, and as such, quality must be centered around all. I think John is ready. John, you want to go ahead?
Yeah. No.
Okay, go ahead, please.
All right. Thank you for this wonderful presentation. I really learned from the what doctor was saying about medication error. So in a case of not following the right protocol on medication error, what would be the result on the patient? Thank you.
So I think he's asking.
Thank you, John. So if I understand is in the case of a medication error and the person didn't follow the protocols, right? Because we have policies and protocols that are set in place. I think also stepping back and looking at, so why did the person not follow this protocol? Right? It could be that there's a difficulty in the protocol that we have instituted in the policy. So it's taking a step back, even with the person. There's certain things that, yes, there need to be corrective actions that are taken. But sometimes it's looking at the process, right? The policy might have flaws that we didn't know about before. I'm not saying that, at EHA Clinics, all we do is, look at the process and there's no consequences to what happens. But we try and take a step back to look at why is this occurring? As I said, it could be in the policy. So for example, if I say we need to separate look-alike and sound-alike medications, but then I do not provide, that avenue or the stickers or the labels or the environment that's conducive for doing that. My expectations in what will happen, and we have a policy, a clear policy that says this, and the person doesn't do what is clearly stated in the policy. Is it really the person's fault? Because we haven't provided the environment that's needed. So again, yes, there are people that do not follow processes, and some you will look back and find out that it was just negligence on their part, but it's still important to ask that question, why? Why? And we use this, one of our tools a lot is the 5 whys, where you ask a question, you keep asking the question till you get down to the root of why the problem occurred, right? So if I say, why did they not follow the protocol? Then you answer. And then whatever answer comes up, you keep asking till you get to the root of the problem. So again, it could be the person that's the problem, or it could be, in your process. So it's always good to dig further than just assuming that it's just the person not wanting to follow policy.
Thank you so much, Dr. Anthonia. I'm just going to read, there are a lot of questions. Please just understand that for every attendee, we're going to have another session after the last presentation where we're going to take a lot more of the questions. So if we don't get to your question right now, don't fret, we will get to it eventually. So the next question is, like you said, quality is non-negotiable, and as such, quality must be centered around all processes throughout the development stage and beyond. In your experience, could you please shed more light on effective approach of not compromising quality in the event of emergencies in a healthcare facility, as an individual might be overwhelmed with emergencies, thereby compromising patient safety?
Okay, I think that's a very good question. When you have good processes in place and training, and you have policies that guide some of the things you do, even when it comes to emergency situations, you're able to fall back on those things. So for example, one of the things we have in our emergency department or in our emergency room is our crash carts, right? It's all labeled with the medications, sound alike, look alike, they're separated. There's easy access. So in emergencies, you don't have to compromise quality when it comes to medications. These things are accessible, they're right there. You can grab it and it's easy, it's color coded and it's easy for you to be able to identify what you need in an emergency. When you're trained in an emergency situation, so for example, all our staff are AACLS and BLS certified, right? So when emergency comes, providing that right training for personnel to be able to carry out their jobs effectively. Even when emergency comes, you find out that they're able to do what they're supposed to do, right? And as I said, again, we have policies in place that will train staff. So it's important to ensure that all staff are well trained and they understand the policies that are put in place, what the procedures are, what the steps are. Again, when you're in an emergency, a lot of times things get thrown out of the way. But when you have a process and a policy that are well understood by everybody in the team, then it's just easier to avoid some of these mistakes from happening.
Okay, so I'm going to take one last question before we go. And the last question is, are there any sanctions attached to your policy? I guess that's sanctions when things go wrong.
We don't have sanctions attached to policies, right? We have policies in place, and when there's a breach in policy, there's a process that's followed. So I can say that for our antimicrobial stewardship policy, if it's breached, there's a sanction that is in place for that particular policy. So for example, if we look and see that there's errors in antibiotic use, we go back and actually once we look at the chart, we have a conversation with the clinician on sort of why this is happening. And when you do that, there's a pattern that, as you said, when you look, there's a patterns that will emerge. Sometimes what we do is we put people on performance improvement plans. to be able to get them to the place where they need to be able to provide that effective care or understand what that policy is. Again, I don't want to paint a pretty picture like we don't fire anybody at EHA Clinics. Sometimes it gets to that, but that is not our go-to at EHA Clinics, right? We try and see what the problem is and see how we can improve our process, and then see how we can improve that individual. Sometimes it might be just a little bit more training that individual needs. Sometimes we have queries that are raised, right? They answer the queries. Sometimes letters get put in files for certain things, but again, the process is followed, and the policy is followed, and everybody is aware of what that process is within our organization. So, so that's how we approach, when there's a breach in policy or breach in any protocol that occurs.
Thank you so much, Dr. Anthonia, for that. You have a lot more questions, but we're going to have to answer that during the next question and answer session. So thank you so much for your awesome presentation. Thank you so much to all the attendees, because they're so engaged. I can see all the chats and all the questions, so it's awesome. Thank you. And I will start to share my screen again so that I can introduce our final speaker for today. I just want to assume that everybody can see my screen. Okay, our last speaker for today is Dr. Toyin Ajayi, who's a senior obstetrician and gynecologist with over 20 years of clinical experience in the United Kingdom, where she was trained. She's a member of the Royal College of Obstetricians and Gynecologists in the UK and obtained her MRCOG in 2014. She obtained her medical degree at the Imperial College School of Medicine in London in 1999 and went on to complete her specialist training in obstetrics and gynecology in numerous world-renowned teaching hospitals, mainly in the London and Oxford regions of the UK. She's an alumnus of the Management Acceleration Program at the Lagos Business School. She's also a member of the European Society for Human Reproduction and Embryology, ESHRI, and the Association for Fertility and Reproductive Health in Nigeria, FRH. She has attended and presented at numerous professional conferences in the UK and abroad. She is passionate about women's care and transforming healthcare in Nigeria. She currently serves as the medical director of the Bridge Fertility Clinic in Nigeria. Ladies and gentlemen, our last and certainly not least speaker for today, Dr. Toyin Ajayi. Welcome, Dr. Toyin, and I'm just going to stop sharing my screen right now so you can go ahead.
Thank you so much, Dr. Ifunanya, for that very kind introduction. I'm so happy to be here. It's been a really fascinating morning so far, and actually, the speakers have really just given us such great information, from Dr. Ajayi to Dr. Anthonia and Adam as well. So hopefully my last discussion will also be relevant. Hopefully everyone is still awake and still engaged so that we can just finish off this session. So thank you so much. I'll just share my screen. I hope you can hear me properly. And
yes, we can.
Okay, great. So I'll just share my screen. Okay, so I hope you can see my screen.
Yeah. Yes, we can.
Perfect. Okay, let me put it on slideshow. Okay, so thanks so much for inviting me to sort of discuss this topic. So understanding quality management systems, but what does quality mean to patients itself? So I'm going to do that with this outline. Just going to talk about quality and quality management systems in terms of what they mean, go over the principles of quality management, speak about PDCA cycles and why it's important in a quality management system, talk about how do we actually improve patient care using the QMS, and then touch on some error management and how that impacts on services and on the patients as well. Okay, so what is quality? We've heard a lot today about quality and quality management, and I like to think of it like an umbrella because it encompasses, lots of different aspects. So I'm going to focus more on a quality management system, which is really speaking to all the organizational processes that you have in place to ensure quality. Now, quality assurance is essentially making sure that all those activities can be shown to actually provide confidence in the product. And quality control is the checks. So like Dr. Ajayi mentioned, I think, quality control is more of it's a reactive thing. So you're checking that actually your product works and that there are no issues with your product. So a quality management system in itself, obviously is, I really believe it's an essential element that has to factor in any healthcare facility. If you want to give good quality healthcare, you must have a quality management system, because it just provides you with a sort of set of policies and processes and procedures that actually are meeting customer requirements. It improves your business operations, it drives organizational culture, it focuses everybody on that goal. What's the vision, what's the mission of that organization? Because if you've got this QMS system in place, everyone is really keyed into it and understands on a day-to-day what they need to do. And I think, like all the speakers have mentioned, quality management, quality is not a department. It's not a certificate. Every single person in your organization has to be their own quality officer. They have to really just have this quality management system, this framework, really driving everything that they do every single day with every interaction that they have with clients as well. So a good quality management system, it has to just have the right features. So you want it to satisfy your customer needs. Without our customers, which are our patients for us, we don't have a business. So we have to ensure that we are actually satisfying the customer needs, that we're ensuring there's customer satisfaction. We're ensuring our clients, our patients are safe in all that we do. And that QMS must also deliver all of this with as few failures as possible. It's got to be effective. So like I said, your endpoint is your customer requirement. What do your customer need? You're trying to drive that customer requirement. So your service that you're putting in as an input has to be key. You also have to know what your output is. What am I actually trying to achieve, in this whole process? So it must be an effective QMS as well. And it's got to be efficient, because at the end of the day, you want this to drive your performance. All right. You want to have a superior business performance in terms of the services you offer, and also, a good QMS will actually, lower your operational costs and all sorts of other things as well. So overall, you want it to be an efficient system. So Dr. Ajayi has sort of focused on this, mentioned this, but I'll sort of go into a little bit more detail on really the principles of what a good quality management system should be. And we've got 7 main principles, and I'll just dive right in. So like I've said, the first thing is really about the customer, and I think this is something that we should keep on going on about, because if we don't focus on our customers, then we really have no work. We haven't got a business, and unfortunately, we all know of, places and facilities where customer focus is not the priority, and that just leads to disgruntled customers. You're not going to get anybody coming back to your business, and therefore your business is going to fail. So if we focus on our customers, like I said, it's a referral system. You've got repeat business coming in, the reputation, you're building a brand as well, because your customers, word of mouth is a brilliant tool as well. So you've got a great brand equity as well if you're focusing on your customers. And at the end of the day, your customers stay loyal to you because they're satisfied, they feel safe, they can trust you. And that trust being earned is another really key factor in ensuring the customer focus. So this is, I think, one of the most important principles of quality management. Now, Dr. Ajayi spoke about leadership, so I won't go into too much detail about that. But again, in so much as every single person has to, carry a QMS, within their hearts as a mindset, without leadership, nothing's going to happen. So the leader of the organization has to be the one to really believe in this, so they can then, ensure that everyone else gets aligned. They can train other people. They can, let people understand the importance of the quality management system, and therefore, by them just having that oversight, they're able to ensure that from a strategic point of view as well, you're actually meeting your strategic objectives. The quality management system really is your strategic objective, if you look at it in detail. So as long as the leadership is intact and the leadership drives the quality management system, then everybody else is just going to deliver results because they believe in it, they're aligned with it, and they understand the need to actually meet that strategic objective and that focus as well. And I think we also spoke earlier on about, engaging people. So like I've said, you know, every single person has to buy into a QMS. You can't just bring it to your organization and think it's going to work. You know, everybody has to buy into it. You know, so when people are engaged, you know, right from your security at the gate, you know, to your reception staff, to your nurses, your doctors, your healthcare assistants, your laboratory workers, you know, everybody in the system, you know, you have to engage them, because if they're not engaged, then they don't understand that every single thing they do is actually based on that quality management system. So if your people are engaged, they're more satisfied, they understand their role better, and they able just to collaborate with you much better to really just ensure that, you know, you're meeting the standards of care that you're really promising your patients to have. Now, this is really, you know, a very important part, because you need to codify all your processes, you know, to have an effective quality management system. So you have to write everything down and codify it. And that way, you know, no one is doing things, you know, out of the expected standard, you know, so you need to have a lot of SOPs. You know, so you have SOPs for absolutely everything. Again, SOPs, you know, from the security man in terms of how they interact with patients when they come in, you know, every single person must have SOPs that drives their processes. And, you know, every process has an input. So what is it that's actually inputting to this process? And then what am I trying to get out? What's my output? And these have to be measurable as well, because if they're not measurable, then it's very difficult to actually be able to, you know, check and see what's actually being done. You know, and this way, everybody can focus really on what their key processes are. And you can just ensure that performance is optimized. You know, it involves a lot of documentation, so process maps, you know, as well have to be, you know, really key. You have to have all the right forms for everybody to be able to do what they need to do, from consent forms to information leaflets to, you know, your drug, your lab request forms. You know, all these things have to be in place. You know, and then, like I've said again, the human resource part of it, you know, you must continually keep on training people, you know, training your staff, transferring knowledge, you know, to ensure that actually they understand this process, you know, they're trained on this process, and then you sort of audit them to check that they're actually able to deliver this process in a safe way without causing any harm to your patients, who, like we said, are your customers, and who, without who, you know, you essentially don't have a business to run. And the whole point of all of this is you're trying to make things better, all right? You're trying to improve the business, you're trying to improve performance, you're trying to improve the customer experience, you're trying to drive innovation, change, you know, how can we do things better? You're trying to be able to, you know, minimize those risks that might be present in your organization. So improvement is really the key aspect of any quality management system as well. You know, and I think Dr. Anthonia had also, you know, mentioned this when she was talking about, you know, the root cause analysis. So, you know, for any error, I'll speak about that a bit later, any error that happens, you know, you must investigate these errors. You know, find out the root cause, and you're not investigating the person. It's not punitive. You're investigating, you know, the error and what process. Was it a process failure? Is it because we don't have the right SOPs? Is it because there's a training gap? You know, is it because we need to innovate and do things differently? So, you know, this is the only way you can actually improve what you're doing, from really just a systematic and codified point of view. And the real emphasis is on that prevention. You know, you don't want errors to happen. You want your patients to be safe, because that's what the patients really are looking for when they're looking for quality care. They want to be safe. They want to be assured that when they come to your facility, they're going to be safe. They can trust you to do the right thing for them. You know, and you can't really practice any kind of medicine without evidence or data. I mean, you can, but it's probably not the best kind of medicine to practice. You know, so again, you know, another important principle of a quality management system is ensuring that all your decisions are based on good, robust evidence. Because why? Because to practice, you know, to give good clinical care, you must base that on good evidence. You know, you want to give your patients the best in terms of standards and guidelines, and it just helps you to improve your decision making. It makes everything a bit more efficient. You know, and again, you know, you can challenge things as well. You know, we're very keen at Bridge Clinic, you know, for people just to not accept the status quo. You know, yes, we've got SOPs for everything. You know, yes, they're all evidence-based, but, you know, if you know of a better way, or you've, you know, got evidence or data that we can do things in a better way for the patient and for the organization itself, you know, that really just speaks to our strategic vision and mission, then by all means, you must come and talk about that, so that we can look at it critically, you know, dispassionately, and make those decisions, you know, to improve things by changing certain processes if truly the evidence suggests that it should be changed. So that's a really key part as well of a good quality management system. And you must remember, that you have collaborators, and I think this slide just speaks about collaboration. All your stakeholders who you have to work with to ensure that you're delivering, this QMS properly, to ensure that all your supply chains are stable, to ensure that the people you're collaborating with understand what you're trying to do. So your vendors even have to understand what your quality management system is all about, to ensure that you're able to even screen your vendors, maybe develop a vendor registry to ensure that your vendors are also adhering to what you've defined, from a context point of view as an organization. So collaboration, I think, again, is really very key, internal and external, actually. Okay, so I mentioned a PDCA cycle, and Dr. Anthonia also mentioned this as well. And this is a really, like a foundation really for your quality management system. All right, it's all very well wanting to just have a QMS, but what does that actually mean? So you have to, you have to plan, you have to do, you have to check, and you have to act. And the leadership, like we said, is at the center of this. So I'll go into a little bit more detail as to what all this PDCA, what it actually means from a practical sense. So the planning stage, right? So, what's the context of your organization? So this again speaks to what's your strategic vision, what are your objectives that you're trying to achieve? And you've got to define objectives. Otherwise, there's no way to measure if you're actually achieving what you're planning to do. All right, you've got to find your internal and external partners. So your internal partners are really your colleagues and your staff. External partners might be, your vendors or other people maybe like labs that you're collaborating with as well. And it's very important in your planning stage to also identify any risks that might come up and prevent the objectives being fulfilled. And then how do you mitigate those risks? So again, you've got to put things in place to see how you can try and mitigate those risks happening as well. So once you've planned and got very clear objectives, then the really hard part is actually the doing. The doing is very easy to write a beautiful, white paper, have a great document outlining all these great things, but actually doing it is actually difficult, because to do, this is when you need all your engaged staff, like we mentioned before, which is again a really important principle. The plan has to be simple, clear, straightforward, and then everybody needs to understand that plan so they can actually start, doing it, what you need to do. And it's all about having, targets that are attainable as well, so that you can actually just, track those targets that you're trying to achieve in this part of your cycle. Now, again, you've done all this stuff. Now, how do you monitor? How do you check? All right. This is probably one of the most important parts, because it's all very well doing things, but you need to ensure that actually, is it working? Is this actually working for me? Am I getting these objectives? Are they being met? Are there lots of risks and errors? Are my patients being harmed? All right. So you monitor and measure, based on usually using audits, so internal audits, and that is a continuous process. You're continuously auditing internally, you're having external audits as well. One of those, for example, could be an ISO, certification and re-audit that happens, on an annual basis to ensure that, you're still sticking to all those objectives. So this is a really, really crucial part, because this is where you have to really just be quite honest with yourself and the organization, and, really just check that all those processes are being adhered to. And like I said, audits are fantastic. Some people are not used to audits, but I think they're just such a great tool for you to be able to just measure how you're doing based on what you've planned to do. And then once you've been able to sort of have a look at the results of your audits and all your processes, you then know, right, okay, what I need to do to improve. Okay, so the next step is acting. And this is basically all things you do based on what you found out from your audits, to try and improve things and get where you need to be. Because at the end of the day, nobody's ever perfect and things are always coming up. All right. So where did you fail? Are these process failures? Are these training gaps? Is it lack of having codified processes and systems? So it's a constant cycle. It doesn't ever end. But the goal is really continuous improvement. So once you've done this act bit, you then go back to plan again, because obviously you need to now maybe add in some new plans, set some new objectives to try and ensure that you're meeting your defined objectives, and the cycle continues. So it is a constant cycle, but it is a critical cycle, because that's the only way you can really ensure that your quality management system is fit for purpose. All right, so obviously, the patients are what are important in all of this. So how does the QMS actually help patients? What good is it to them? If you tell a patient, oh, we have a QMS, they probably haven't got a clue what you're talking about. So they really have to just be able to see what that is by their interactions when they come to your facilities. So very, very important parts of a patient experience. We know that comprehensive care, so again, your quality management system will have helped you codify everything you want to do with SOPs, with good patient information leaflets, with all the relevant things they need. All right, so that's really key from your quality management point of view. Communication is key as well. So all your nurses, your doctors, whoever else communicating with your patients, that's a really important part of patient experience. Now, the great part of the quality management system is that documentation is a very big part of this. So everything is documented, all right? So a lot of times, maybe when you're trying to audit you're doing a documentation audit, for example, and this happens quite a bit, and sometimes you can be quite worried because when you look at your EMR system, it looks as though maybe your nurses and doctors have not spoken to your patients for months on end, and that's just not okay. Now, when you then maybe engage your staff, but Dr. Toyin, I chat her up on WhatsApp, I sent SMS, which is fantastic. So I'm reassured that you're communicating with your patient. However, if it's not documented in our codified, defined QMS, it didn't happen. And then you then find yourself, if you've taken to court and you're trying to, defend some behavior and error, again, if it's not written, if it's not documented, it didn't happen. So, I think that that documentation aspect of the QMS is so important. We are communicating with our patients, I hope we are, but we need to document that we actually are communicating. And again, that also helps to ensure that, it's a system, so that when Dr. Toyin's not around, Dr. Angela can pick up, can have a look at the case notes. And because Dr. Toyin documented beautifully, Dr. Angela is very clear on what needs to be done for this patient. But if we're not documenting on the codified, pre-agreed formats, then this breakdown happens. And again, the patients are the ones who suffer because there's no a handover of care according to them. So like I mentioned again, proactive staff, very, very important. This is all about, again, one of the principles of quality management, engage staff. So staff, who are just not happy to accept the status quo. All right. I think the best staff are the staff who question you, and it's good to be questioned. I know we have a culture where, it's a little bit hierarchical, that's the word, and, as doctors, we don't like to be questioned, but quite honestly, we need to be questioned sometimes. There's nothing wrong with a nurse, a lab technician, anybody questioning something, if they really feel that you're not doing right by the patient. If they feel that maybe you're going against the QMS, you're not sticking to the SOP, you're acting outside the SOP. So that's what proactiveness is about. Staff who are not scared to question the status quo, staff who want to be creative, who want to be innovative. This all really just lends into the patient experience. Adam spoke greatly on technology, so I'm not going to go into that in detail. But again, we have to really realize that we're now in the age where technology is really what is going to be the mainstay for our patients in terms of giving them the best patient experience, so that they can sit in their house, have a consultation, order labs, order blood tests, get their prescriptions, and really have to come into the hospital or the physical building, at a very minimal time, because again, everyone's time is now so precious as well. And again, improving the patient experience in healthcare, again, 3 C's: communication, collaboration, and caring. I can't say enough about communication. It seems so easy, but it's something that a lot of people are not good at doing. And sometimes you need to have training in effective communication, because it's really the cornerstone of any interaction with your patients as well. Collaboration, like I said earlier on, is key, with your stakeholders, internal and external. That always, results in positive patient outcomes. And again, we're in the healthcare business. It's surprising how many people in the healthcare business maybe don't know how to show they care. I don't want to say that they don't care, but they might struggle to show how they care. And caring for the patient is really all they really want. They want to just feel like someone in that particular facility cares about them, is thinking about them, and wants them to have the best possible outcome. And the experience is just much improved if these 3 things can be implemented, or practiced, should I say. So talking about the caring, I just thought I'd briefly just mention empathy, because I think you can't have a quality management system without empathy. And empathy is, again, something which, we can train people on. Like I said, a lot of people have empathy, but I think a lot of people struggle to actually show that empathy. And we all know that empathy is very different from sympathy. Empathy is being able to walk in someone else's shoes, really just experience what they're experiencing. Literally putting yourself in their own shoes, and how would I feel if I was going through this? It takes a lot more to show empathy than it does to show sympathy. Sympathy kind of pushes us away. Empathy brings us closer together. you know, and I really believe that without empathy, you really can't run an effective quality, quality management system, or sort of an effective service without empathy. You know, and like I said, you know, it's important that we all realize that no one is more important than anybody else. You know, again, I think, you know, we're in a society where we can struggle with this a little bit, you know, and I think, and we see this, you know, in the healthcare space as well, you know, in terms of that sort of, certain attitudes that are probably not the best for our patients, you know, because everybody is really the same. You know, you as the clinician providing care have your own strengths and weaknesses and flaws, you know, so you can't then be stereotyping people, you can't be judging people, you know, and this is all part of showing empathy. And this really keys into your quality management and how you deliver this kind of care. So like I said, some people just really struggle to actually show empathy. You know, they might feel it, but they don't really know what to say. You know, and one of the things I hear a lot, you know, I mean, I do a lot of audits with our quality specialists, you know, and a lot of things I hear are people saying sorry, you know, to patients. You know, let's say patients in pain during a procedure, you know, and you know, the whole room is just, you know, repeating sorry like 10 or 15 times. Okay, it's great to say sorry. But a patient once gave me feedback. We had a patient who complained once gave me feedback that sorry should be an action word. Okay, so don't just say sorry, you have to do sorry. So yeah, you're saying sorry, but then what are you doing about it? Okay, you have to do something about it to actually then, you know, improve that patient's experience as well. You know, so this is just a few examples of how to actually just communicate that you have empathy for someone going through something. You know, waiting times. Always a major complaint, you know, a sore point for patients. You know, they want to be seen, you know, straight away, even when they're late themselves, they want to be seen straight away. You know, so again, just sort of understanding how frustrating it is for them to be waiting, you know, just understanding that you'd also be upset, you know, and you can then tell them this by the kind of words that you use. But like I said, you know, we say sorry a lot, but sorry sometimes is not enough. And we have to just try a little bit harder to actually have, you know, have proper phrases that actually just convey empathy in our interactions with our patients. And the same is for our colleagues as well.
Hello, can you hear me?
I can hear you, Doctor.
I can hear you.
Okay,
I think we lost her. Yeah.
We lost her. Okay, I think
I
she's back.
apologize. Sorry.
Hi, Dr. Toyin. Just go ahead and continue sharing your screen.
Sorry about that.
No problems at all.
Wi-Fi kicked me out. Okay, let me just go to where I was. Okay. All right. So I apologize for that. Sorry. Why is it not showing where this? Okay. Right. Okay. So patient safety tools, like I mentioned, are really important in when you are running a quality management system. All right. So near misses, incidents, and SAEs. All right. So near miss is basically something that hasn't happened. All right, but it has the potential to cause harm to your patients or your staff. Or your stakeholders actually, but somehow it's been picked up, maybe by chance, you know, it's been prevented, you know, but the main thing is that it's something that could have caused harm. You know, and you can see in the picture, there's so many near misses here, okay? And, you know, I think what I noticed as well is that, you know, staff are quite reluctant to report near misses because they don't really think it's a big deal. It's like, well, you know, I mean, yes, that cable, you know, was running across, you know, the floor. I could have tripped, but I didn't trip, so it's okay. You know, but the whole point of reporting near misses is to then prevent, you know, more significant things, to prevent harm. You know, so we have to be really intentional about recognizing near misses, reporting them if you have a reporting system, which is usually part of the QMS, and then, you know, how do I prevent it? You know, what do I need to put into place to fix this near miss so it will not become, you know, an incident or an SAE? So an incident, obviously, is when that thing has actually happened. All right. So it's unplanned, it's undesired, it's unintended, you know, and it causes a disruption. You know, it's a low impact effect, but, you know, it affects the organization, the operations, services, or even the patients as well, clients and vendors as well. All right. And so this is something that's happened, you know, but again, when an incident happens, error management reporting is really, really key to ensure that you're looking into why these happened. You're doing root cause analysis, of the process, not of the person that it happened. And they're trying to find out, what can we do? So what's your corrective action, any preventive action? That's a kappa that we talk about, based on the incidents that have happened. Now, this is really what you're trying to avoid by ensuring that you are, picking up and reporting near misses and incidents. You don't want to have an SAE, okay? A severe adverse event, is really a disaster for everybody, and that's not what you want. Your patients can be significantly harmed. The organizational system can be significantly compromised or break down totally. All right, so this is what you're trying to avoid by ensuring that your QMS is picking up near misses, it's picking up incidents, and something's done about it. Okay, because our customers, our patients don't want incidents. All right, they want to have a pleasant experience. They want to have a quicker service. All right, because we need to reduce the level of incidents that happen to them. So that, like I said, the main thing with incident management is that you're actually just gaining knowledge. All right, you're able to uncover patterns. So you might find a pattern that something is always happening, certain incidents always happening. And once you've done your investigations, it might be because there's a process failure, or maybe someone needs extra training, or maybe because there's no codified SOP for that particular thing. That's why it keeps happening. All right. So it really helps you reduce your incident volumes by just determining the best opportunities to improve. All right. And again, once you're able to manage your incidents properly, you can recover quicker, and prevent, repeats of errors happening going forward. Because ultimately you're trying to improve your service. All right. So all this error management, everything we're doing is trying to just get to this point. We're trying to get a better service for our patients. All right. So we need to really just think, once we've reviewed all our incidents and errors, what can I do to make things better? Do I need to do some extra training? Do we need to, introduce a certain SOP? Do we need to, update a certain SOP? Do we need to codify a previously uncodified process? All these things are going to come out of your incident management reviews. When you have SAEs, which are much more severe, those usually will lead to significant changes in the way you do things within your organization. Sometimes, I know that someone asked Dr. Anthonia, I think, in one of the questions about, are these things punitive? Definitely, you don't want to punish anybody. You actually want to help people improve, but there are sometimes some occasions when, if something has happened that's so severe and it's due to a real, a total lack or breach of, set process or the accepted policy within an organization, then consequence management does have to come into play. But you're trying to improve the service, you're trying to improve your people, so that the people serving your customers, your patients, will give them the best care, and your patients will be happy. Because ultimately for the patients, quality for them is all about safety. All right. So we could be talking about all this stuff, QMS, all these big words, but they want to just come to your facility. I know that, they're going to leave your facility in one piece, because some people can't go to facilities and they don't ever leave that facility, due to errors, lack of, following set policies, lack of even defined policies in the first place. So having your QMS in place really does drive what the patients want, which is just to feel safe, to have a great experience, to come out of that experience and to feel better, with minimal harm and minimal errors to them. Because this is what we all want to hear at the end of the day. We want our customer feedbacks to say lovely things about what we're doing, because again, going back to the beginning of what I said at the start, without our customers, without that customer focus, then that you haven't got any work, you haven't got a business, you don't have anything to do. So if we can really just keep this, at the forefront, that this is where we want to end up in terms of what our customers are saying, what our patients are saying, then we know that we're on a win-win, because it means that our QMS is working. We're looking at all our errors, we're driving our visions, we're driving our missions, we're being strategic in what we're doing. We're managing our errors, to ensure that our patients are going to come back and say these wonderful things about us, and also, again, refer clients to you as well. At the end of the day, we're all in the business of running a business. So, you still need patients to come through your door to ensure that your business thrives and survives. So I just thought I'd just throw it at the end. So for us at Bridge Clinic, there are 4 values that are just sacrosanct, that we hold very dear to us, all right? So, and we call them our high values, HIEE. So honesty is what the H stands for, because, we just believe that you have to earn the trust of anybody who's coming to your facility. Like I've mentioned before, If your customers don't trust you, they don't believe you that you're going to tell them the truth, they're not going to come to you or come back to you or refer clients to you. So for us, that's really, really important. Innovation. So I spoke again about, sometimes you need to have your process innovated. So if you're detecting things in your processes that are not working, maybe you need to create something different to solve that problem. There are a lot of problems. There are always a lot of problems in what we do. We are in an environment where problems are the norm as opposed to the exception to the rule. So we're constantly having to solve the problems. So that's really, really important as well. Okay, and what do your patients want? They want you to be excellent. Like I said, they want you to go the extra mile for them. So they want you to, make that extra phone call. Go the extra mile. Whatever your role is, there's always a way to go the extra mile to ensure that your patients are fully satisfied with you. And lastly, for us, being ethical is really just what wraps up our value system at Bridge Clinic. Because you have to do the right thing. And I think a quality management system helps you do the right thing because you have defined your standards, you've defined your goals, you've defined your objectives, and that they've been defined based on evidence, based on the best way to do things for your patients. So if you're going to go out of those parameters, you're probably not going to be doing the ethical thing. It's very hard to practice. Well, no, not very hard, but I think it's a challenge sometimes, to stay true to this for some areas and for some people. But if you have that ethics as your sort of foundation, you really can't go wrong because at the end of the day, your patients will appreciate you for it. So all these 4 values, I think, are just key for anyone to have and to hold dear to ensure that you're really giving the best to your patients. And like I say, your quality management system ties it all together because it really just sets the standard for what you're doing. It gives you all the checks and balances for what you're doing. And at the bottom line, you're meeting your customers' requirements for safe, effective care. Thank you very much. Any questions would be great. Thank you so much.
Thank you very much, Dr. Toyin. That was an awesome presentation. I'm just going to quickly ask Elijah, is there anybody who is online who wants to ask a question? Elijah will unmute you so you can go ahead and ask your question now. I have some questions in the chat box as well. So I'll just give 30 seconds for that. Okay, since I don't have anybody, is there anybody coming offline, Elijah?
No one has raised their hand yet.
Okay, awesome. So I have, I want to start with this first question here.
Sorry,
and
I do apologize. Sorry about that. Sorry, I apologize. I don't know, my internet keeps kicking me out. I hope you were able to hear the last bit of my presentation, or was I talking to myself?
No, we could hear you definitely.
Okay, I suddenly just thought I was talking to myself.
We could definitely hear you.
Sorry.
So I have a question here that says, what is it like when you're crossing the border between increasing customer value versus increasing revenue and market share? I want to, is asking the question, and I think I'm just going to assume that what he's asking is, how do you increase customer value while understanding that it's a business and needing to increase your revenue and market share? Basically, how is customer value and market share and revenue related for a business?
Okay, yeah, I think that's a really good question. And definitely, we are running a business. At the end of the day, everyone's trying to make money. That's what the business is about. So how do you not compromise the customer value, I guess? So I think it's all about selling. It's all about selling yourself. Okay, so you as an organization, you have a value system, right? So you need to let your customers understand, this is what you're getting. This is my value proposition. This is what makes me different. This is what sets me apart from other people. And then you hope that you get the customers or the patients who align, who buy into that, and who are then willing to, pay the cost for that, because some, for instance, they might compare you to another facility, that maybe offers cheaper services, but you don't have all the quality things that we're talking about that you have here. So patients have to understand that in order for them to be safe and to really get the best and effective care, there is a cost to that, so to speak. So like I said, it's all about ensuring that your value proposition is clear to your customers, to your client base, driving that with every interaction that you have. And then as long as you get the right kind of people in, your revenue will be fine because you're delivering the right kind of care. They're coming back for you. They're referring people to you. And you're doing the right thing. And then you become, as a brand, your brand is now known for doing the right thing, and everybody will basically flock to that, regardless of whatever the cost might be.
Awesome. Thank you so much, Dr. Toyin. I have another question. It says, it's very clear that everyone has to imbibe the QMS as a culture for there to be a notable improvement in the healthcare management system. So I'd like to know if there are any QMS training plans in place for people to get to this point.
Is that one for me?
Hello? Yes, that's for you, Dr.
I think getting into QMS or adopting a quality management system, is something that every organization needs to sit down and think about in terms of, is that really what they want to do? In terms of the dedication that's needed for it. Definitely, there are trainings. There are trainings that can happen, and I think probably the best trainings are probably from people who are doing it already. So maybe seek out organizations who already have, established quality management systems, and reach out to them and see how you can maybe partner with them, how they can come in and train your staff, or maybe, starting with simple things like maybe like audits and so on. So I think definitely, reach out to people who already have quality management systems in place, and then see how you can work on, some sort of training partnership with them, to come into your facility and, either set one up for you, training to set one up. There are different ways it can be done, but I think definitely go with someone who's done it already.
Awesome. Thank you so much, Dr. Toyin. At this point, I'd like all of the panelists to unmute your mic. So we're going into the general question and answer session. So I'm just going to try to go through the if we have any more time at the end, we'll take some audio questions. So I will try to answer all the questions here. Okay, this question I don't really understand. It says, you talked about setting patients' needs and trying to, I'm not sure I understand, but I'm just going to say, this part says, what advice would you give in setting up an infection prevention and control system in a healthcare, setting up an infection prevention and control in a healthcare delivery system? And I'll put this question to Dr. Anthonia, who is our resident infectious disease specialist.
Thank you, Dr. Ifunanya. So I think the advice would be to get everybody involved. Our IPC, we have an IPC committee, which I chair, as Dr. Ifunanya has mentioned, and we involve everybody, from us. Every department is involved in that process. And we, there's trainings we have done to qualify us for that as well and to lead us. But again, it's the same thing. We involve everybody from the grassroots and frontline. I think Dr. Richardson had mentioned, the people doing the work are the people that you actually have to engage. So we engage, from our pharmacists to our nurses to our doctors, our stewards, which are the ones that keep our facility clean, just everybody. And then we go through the tenets of what infection prevention control is and implement it. Once you have policies in place, you have a team in place, you implement those policies. And I think one thing that's vital is that you just don't implement things and then let it be. We monitor those things, their checks, their audits that go on. And then we try and improve our processes as we go along. We engage the whole organization. We have, yearly trainings that go on, refreshers in IPC. And we also engage our patients because IPC is also, our patients are part of that. So, either it's wearing masks within the clinic, proper hand washing techniques, and just, proper cough etiquette. So we involve everyone from our patients to every single staff. So I think that's important. And also monitoring the process and measuring and improving the process.
Thank you so much, Dr. Anthonia. I have another question for you. It says that as part of your slides, you showed shows a report of medication error, which states that there is no side or adverse effect on the patient. Can you let us know if it is part of quality process to inform the patient of this error, and what should be done quality-wise before and after informing the patient?
Okay, that's a fantastic question. This is one of the things, even when there's an adverse reaction or something you caught, this happened within our organization. So I'm going to full disclosure, where we caught a mistake that had gone through to the patient, but there was no harm done. So again, we do the same thing. We go through a root cause analysis. Why did this occur? But we also inform the patient. So part of what we do, we inform the patient that this has happened. We call, and then we also assess the patient and make sure that the patient is okay. When we, caught the mistake, we didn't know whether the patient was okay. It was one of those medications that really wouldn't cause additional harm, but again, we had to inform the patient. We were very apologetic. We informed the patient about processes that we needed to, like what we were doing about the issue. It was not punitive, how we were going to look into our processes to improve. And I think the patient was appreciative of that fact that we disclosed that to them. Not everybody's going to be happy when you disclose. People are going to be angry because, of course, the error shouldn't have occurred. But again, what we try and let our patients know is that it's something that we take seriously, and it's something that we will ensure will not happen again. Because again, we'll see what the root cause of that issue is and then address it. So that's what we do, actually. We do inform the patients. We bring them in and have a discussion with them and see if there are any adverse, even things that they might not know, and evaluate the patient and make sure that there's no harm that is caused to the patient.
Thank you so much, Dr. Anthonia. I have another question, and I think, Adam, if you can take this for us. It says, in your experience, what are ways staff can upwardly influence leadership of facilities or organizations to inculcate QMS in their approach to management, for example, in the public sector?
Oh, in the public sector? Oh, that's a good question. Well, so I think there are a couple of things. I mean, at the end of the day, the first part of managing quality is that communication piece, and so there needs to be communication, and if and all staff need to be able to communicate to their supervisors about quality issues, about reporting events, reporting safety issues. That has to be from the start, like really kind of key to the whole process. The challenges with any sort of quality management system is that it really has to be kind of supported from the kind of organizational culture and structure. And if there's a culture that everyone has to report to the to the head boss, and the head boss makes all the decisions, and none of the teams are really empowered to report or fix or change anything, then it's going to be really hard to have a quality management system, if not impossible. So unfortunately, I think the challenge is that quality management is from an institutional point has to be kind of incorporate from leadership to the front line. As an individual, obviously you can do quality work. You can be focused on patient safety as part of your work. But in order to make that as part of the organization, it really has to be a cultural shift and in how the organization runs and addresses quality and patient safety.
Thank you so much, Adam. I have another question for you. So the question is, we know primary healthcare is the first contact when it comes to healthcare delivery. We also know there's this challenge of improper infrastructure and facility for primary healthcare centers, especially in this part of the world, to deliver basic, service. So when it comes to leveraging technology and even providing quality services, there's this concept that this is expensive. Can you help shed more light on this? Also considering that we have a poor population to attend to, how do we bridge this?
Yeah, so again, I think it's about shifting, quality is not about having, fresh paint on the outside of the building. And, it's not about having fast internet. Quality, is about, having a log of, needle stick events in your facility and a process of addressing them. That's not an expensive process. It's about keeping track of prescription errors and having a process to address them. That's not an expensive tool that you buy to do that. Those are processes that you put in place to keep patients and staff within those facilities safe. And so I think, unfortunately, we link quality to consumer goods that are more expensive. And I think we need to kind of get rid of that part of the process and think about quality as these basic systems that improve patient safety. I think technology, one thing that technology can do in terms of lower income environments is provide some of those resources and tools directly to the front line. I mean, one of the benefits of a community health worker having a mobile phone is they can look up the treatment guidelines for postnatal care, right? Or for a particular aspect of postnatal care and follow a checklist, on their mobile device. And that makes some of those aspects, and that could include like training videos and ways to do certain things. And that can help get some of that knowledge and access to care to the environments. And it doesn't matter that the facility is pretty. I mean, within EHA Clinics, we have our community health team, and these people work in the community. They work, house to house in people's houses in very low income environments, and they have the exact same quality control processes that we have in the clinics. They have, in these very low income environments, because it's not about cost. It's not about investing in expensive infrastructure. It's about having those processes in place and a mindset and a culture towards that patient safety. And that doesn't cost any money to do that, to put those types of things in place.
Awesome, Adam. Completely agree. Last question for you, and I'll let you go after this. It says, how do we manage patient confidentiality and still be able to leverage technology in healthcare?
Oh, yeah. So I'll come in on that one. So yes, so this comes up a lot. When I first started working on technology systems in healthcare, the privacy and confidentiality topic came up a lot. And the clinic I was working in was an HIV clinic in Kaduna, and they were worried about people have access to the records once they were electronic. But then when if you went through the record rooms and when a patient came in, they pulled the record out, and every patient that was HIV positive had this bright orange sticker on it. And that's how they kind of, visualized, so they knew which patients were HIV. But the problem is everyone else knew that as well. So they thought, well, this is more private because it's a paper record and people won't get the electronic records, but there wasn't any privacy built into that. Unfortunately, technology systems are just complicated. Some EMRs are better at managing that patient access and that data access better than others. So really, it's about an evaluation, and it comes more down to process than anything else. There has to be clear guidelines of who's allowed to access what records. Hopefully, you have an EMR system where you can kind of structure that, permission level, and at the same time enabling patients to access their own data in case that they want to go to a different provider, and or if they need need to review that information. It's really these are policy level things that you can do. Hopefully the technology you use have abilities and to put those access controls in place for privacy and confidentiality. But again, I think it comes down to culture. Patient confidentiality and management is a culture thing. I mean, there's tons of stories and from the US about people being, hospitals being fined because, they had like a VIP patient and someone wanted to know what Madonna was in to see her GP for. And so that, they look at the record but if you have a good system, it should have logs of who accessed that record. That way, when you do these audits, you do these patient confidentiality audits as part of your quality management system, you can pick out random records and say, okay, well, those were accessed. Why did that person need access to that record? And then you can see if there's errors, and then you can kind of adjust them accordingly. Yeah, but it is a really fine line between we want data to make decisions and to improve communication, but then you've also got this kind of double burden of making sure that information is being used appropriately by the appropriate personnel.
Thank you so much for that, Adam. I have another question. I think Dr. Toyin, if you can help me with this. It says, how do you get patients involved in the quality assurance process? Because I think quality assurance is everyone's responsibility.
That's a great question. Thank you so much. So I think it starts from just engagement and awareness. So, like we said, that one of the first principle of quality management is customer focus. All right. So you're ensuring that your whole business, your goal is really to be sort of customer centric. So every single thing that you're doing is having the customer at the center, the patients are at the center of that process. And like I said, it also just involves education as well. So a lot of patients don't really understand their rights. They don't really believe they even deserve, a certain level of quality healthcare and so on and so forth, especially in this part of the world where we are. So I think it's incumbent upon all of us to actually be educating our patients as well. So they should be able to question you, ask you questions, query their doctor, ask for better explanations. I can't tell you the number of people, even friends of mine, which surprises me, because we're all meant to be, a certain level of education. Will tell me, oh yeah, the doctor gave me, this medication, and I'm like, what is it? And they're like, I don't know. And I'm like, how do you know? Why are you accepting something without asking, what it is? But that's something that we just see very normally. So I think we just have to educate our patients better in terms of rights, in terms of them understanding that they deserve the best, that they can ask questions, that they can, pick the right place to go in terms of, going to a facility that is maybe ISO certified or JCI certified, let them understand what all this stuff means so that they know what to look out for when they're also seeking medical care. And, and involving them along the journey it's all about engagement and communication. You must carry your patient along every single step of their journey. They have a right to know what's going on, and they have a right to make that decision with you. It's a joint decision about the care they're going to receive. You can't foist a decision on somebody or a treatment plan on somebody. They have to agree. They have to buy in. Well, they're not going to follow your treatment plan, so you're a lose-lose. So by involving them in that quality process, by letting them understand and educating them, that's the way I think we could do better by our patients.
Thank you so much, Dr. Toyin. That is such a great, such great feedback. We're at time, but I'm going to take one more question. Dr. Anthonia, this is for you. It says, and I think it's a very important question, it says, how do you manage turbulence that is bound to occur sometimes when the pharmacist queries a doctor's prescription in an organization? This is a very frequent discussion that we have. So Dr. Anthonia, over to you.
Okay, in the event of sounding like a broken record, it's culture, right? So I would say that when we started this, that the doctors were happy, the pharmacists coming up and telling them that their prescriptions were wrong, but I think over time, one of the things that we really tried to create at EHA Clinics is this culture of equality and a culture where people know that, it's everybody's business. Safety is everybody's business. So everybody is allowed to speak up when it comes to safety and patient care. The doctors understand that, the nurse can challenge, their care, and we do so respectfully as well. When you create a culture of respect, and also an environment where they know that there's safety in what you say. In the beginning, there was friction, but again, I think it comes from the management and sort of the culture that is imbibed within the organization. So the people come in and sometimes they've worked in different places where, especially the doctor is king and everybody else sort of falls in line and follows what the doctor says. But if you continue along those lines, you'll find out that doctors are not king and doctors make mistakes. I appreciate it when a pharmacist comes to me. So it starts with me, I'm the chief medical officer here. The pharmacist can come to me and tell me, Dr. H, which they call me, there was something in your prescription, or you omitted something, or something happened, or I want to check, the dose that, you sure this is the dose for the medication that you want to use? And I appreciate that. And I give them the opportunity to say that. I might say, no, this is the dose, and this is how I came about the dose, or yes, thank you, this was an oversight, or no, you have not put in the prescription. So we empower everybody to, at each and every stage, if we have a policy, everybody needs to abide by that policy, and you make sure that it's not because I'm the CMO that I get an exemption. So when people see you doing those things and seeing that a nurse can, come and tell me that, maybe, this medication, we need to revise it, or there's an issue here. Again, it's just creating that culture. It's not easy to create that culture, and it's something that's continuous that we keep on working with. But I think that for the most part, most people, pharmacists can speak to the doctors, and nurses can speak to the doctors can speak to the pharmacists. And one of the things too that we have, and when you see our workspace, where all the doctors and nurses, the pharmacists, everybody sits in one workspace. And so that you can communicate quite effectively and easily to each and every person. So the pharmacist is not locked up in their room, or the nurse is not stuck somewhere. Everybody sort of sees everybody as they go along seeing the patient. So communication is key, and respectful communication is key, and also creating that environment.
Thank you so much, Dr. Anthonia. I'm going to allow the panelists an opportunity for any last words. So I'll start with Adam.
Great. Well, just to thank everyone for attending, and obviously thank the other great panelists. I think it's been a really fascinating discussion. I love that people are thinking about quality systems and discussing how we actually go about implementing these, and moving beyond this certificate on the wall kind of process, and really kind of imbibing safety and quality as a culture in the institution. Unfortunately, we couldn't present any of the kind of quick fixes. It really is a mindset shift and a culture shift, more than a checklist, unfortunately. And I think that hopefully everyone's willing to kind of start that journey, and in whatever way, whatever small way you can in your position, and start having those conversations about what that means. The discussion around empathy, again, I think is really fantastic. If you just step outside of your professional role and think about yourself as a patient, as a customer in these places, it becomes, quality becomes, much more obvious of a journey that you need to take as a person that's receiving, this care. And so anyway, I wish you all the best on your quality efforts, and definitely be in touch with us and our team if you need some assistance on that journey.
Thank you so much, Adam. Dr. Toyin, over to you.
Yeah, so I think also just to say, thank you so much for having me. This was just a fantastic, the time has flown. It's been really impactful, I think. And I think it's great to see, that pretty much, like over 100 participants are still here at the end of the session. It just shows that everyone is really engaged, like Adam said, and everyone really wants to know, how to go about doing this, because it's key, it's critical. So I think that's just really encouraging, because like Adam says, it is a mindset change. It is a cultural thing. It is a culture. Also, like Dr. Anthonia said, which is very hard. But if everyone is interested and everyone is actually, attending webinars such as this, we're doing more things like this to just let everyone have a forum to really just understand a bit better. I think we'll have a huge shift in our healthcare delivery system, and that's just best for our patients. So yeah, I think thanks so much. It's been fantastic. And like I said, Bridge Clinic is here to help anyone who's interested in what quality, how to go about having a quality management system in your facility. We're very, very open to helping, and from that point of view. So yeah, thank you.
Thank you so much, Dr. Toyin. And our last words from Dr. Anthonia.
So I just want to say thank you. This has been a really just an interesting time, and I just thank you for the opportunity to speak. And you guys as an audience were engaging, and I learned a lot just sitting down and from the other panelists. So I thank my other panelists as well, and Dr. Ifunanya for doing a great job moderating. I think I said it before, and I just would leave with these words, that quality is everybody's business. So don't, if we haven't mentioned like your specific role in an organization, quality is also your business. So think about that in ways that you can go back to your institution, your organization, and impact your organization with good quality care. Because at the end, the patient is who we're doing this for, and hopefully we will impact our environment and our, the healthcare space. So thank you, everybody.
Thank you so much, Dr. Anthonia. Finally, we're concluding this event, just 8 minutes over time, which I think is very good for our first webinar. I just want to thank all the panelists for agreeing to be with us today. I know that I had to take you out of your very busy schedules, but it's been such an engaging session. 3 hours have just pretty much flown by. And, just to thank the leadership and management of Bridge Clinic and EHA Clinics for, just encouraging us in this quality journey. I'd like to say a special thank you to the communication team of the EHA Clinics and Bridge Clinic, Bimbe, Daniela, Becky, Abdul Karim, Chioma. You guys have been awesome just getting the word out there. Elijah for being our IT guru and just setting up all that we need to have today so that this has gone without a hitch. And I just wanted to remind everybody that this webinar will be available on YouTube, and the speakers have graciously agreed to provide their slides, which we'll try to put together as PDFs and send to everybody. And we'll make available your certificates as well of attendance and your CME points. So thank you very much, everybody. Have a very wonderful World Patient Safety Day tomorrow. Thank you for joining us, and we'll see you next time. Thank you.
Thanks. Bye-bye.
Thank you, Dr.
Bye, everybody.
Wonderful, wonderful moderation. Thank you.
Thank you.
Thanks,
bye, everybody.
Bye, Dr. Anthonia.